ಇದಕ್ಕೆ ಚಾರ್ಜರ್ ಒಳ್ಳೆಯದ ಸೌಂಡು ಸೌಂಡ್ ಸ್ವಲ್ಪ ಕಮ್ಮಿ ಇಡ್ಲಿ ನೋಡು. ಅದೇ ಕುಸ್ಕುಸ್ ಮಾಡಕ್ಕೆ
Welcome to Pragalbhyam, the 24th annual insites. As we are gathered here, let's take a moment to remember the divine. Join me in welcoming Dr. Sanjana to receive a heartfelt prayer song. invite Dr. Rachana from Ayurveda Vaidyas to deliver the welcome speech. Please join me in welcoming her. Dr. Dileep Kumar, Medical Director, AIARD, ಇವರಿಗೂ ನಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ ಆತ್ಮೀಯವಾದ ಸ್ವಾಗತ. ಹಾಗೆಯೇ ಇಂದಿನ ನಮ್ಮ ಪ್ರಾಗಲ್ಭ್ಯ ಆರನೇ ಉಪನ್ಯಾಸ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ರಾಜ್ಯದ ಹಾಗೂ ದೇಶದ ವಿವಿಧ ಭಾಗಗಳಿಂದ ಆಗಮಿಸಿರುವ ಪ್ರಾಕ್ಟಿಷನ್, PG scholars, UG scholars ಅಭ್ಯರ್ಥಿಗಳಿಗೂ ಹಾಗೂ ನನ್ನ ಮಿತ್ರರಿಗೂ ನಮ್ಮ ನೆರೆದರ ಪರವಾಗಿ ಸ್ವಾಗತ. It's time to take a glimpse into all our Budding Ayurveda. Our presentation will allow you to the highlights of our organization and its mission. Please sit back and relax and have a look into it.
ನಾವು ತಯಾರಿಸುವ ಔಷಧಿಗಳಿಂದ ಎಂದು ನಮ್ಮ ಹಲವು ವಿಶ್ವಾಸ ಸ್ನೇಹಿತರಿಂದ ನಾವು ತಿಳಿದುಕೊಂಡಿದ್ದೇವೆ. ಹಾಗಾಗಿ ಈ ವಿಭಾಗದಲ್ಲಿ ಎಷ್ಟು ಪರಿಣಿತಿ ಹೊಂದಲು ಸಹಾಯ ಮಾಡಿದ್ದು ಏನು ಎಂದು ತಿಳಿದುಕೊಳ್ಳುವ ಕುತೂಹಲ ನಿಮಗೂ ಇದೆ ಅಲ್ವಾ?
ವಿಸಂತ ವೈದ್ಯರ ಈ ಪ್ರಾಡಕ್ಟ್ ಡೆವಲಪ್ಮೆಂಟ್ ಜರ್ನಿ ಇಷ್ಟು ಸುಗಮವಾಗೋದಕ್ಕೆ ಕಾರಣ ನಮ್ಮ ಟೀಚರ್ಸ್ ಹಾಗೂ ಡಾಕ್ಟರ್ಸ್ ಗಳು ನೀಡಿದಂತಹ ಮಾರ್ಗದರ್ಶನ ಹಾಗೂ ಅವರ ಕಾನ್ಸ್ಟೆಂಟ್ ಸಪೋರ್ಟ್. ಹಾಗೆ ಆಪ್ತಾಸ್ ಆಯುರ್ವೇದ ಬರೋ ನಡೆಸಿಕೊಟ್ಟ ಪುನರ್ವಸು ನ್ಯಾಷನಲ್ ಲೆವೆಲ್ ಸೆಮಿನಾರ್ ಆನ್ ಆಯುರ್ವೇದ ಟ್ರೈಕಾಲಜಿ ಅಂಡ್ ಕಾಸ್ಮೆಟಾಲಜಿ, ಹಾಗೆ ಒಂದು ವೆಲ್ನೆಸ್ ನವರು ನಡೆಸಿಕೊಟ್ಟಂತಹ 1 ವಾರದ ಸೆಮಿನಾರ್ ಆನ್ ಆಯುರ್ವೇದ ಕಾಸ್ಮೆಟಾಲಜಿ.
ಹೀಗೆ ಹಲವಾರು ಸೆಮಿನಾರ್ಗಳ ಜೊತೆಗೆ ಒಂದು ವೆಲ್ ಫಂಕ್ಷನಿಂಗ್ ಆಯುರ್ವೇದ ಫಾರ್ಮಸಿ ಹೇಗೆ ವರ್ಕ್ ಆಗುತ್ತೆ ಎನ್ನುವುದನ್ನು ತಿಳಿದುಕೊಳ್ಳಲು ಆ ಕುತೂಹಲದಿಂದ ನಾವು ಭೇಟಿ ಕೊಟ್ಟಿದ್ದು ತಮ್ಮ ಉತ್ಕೃಷ್ಟ ಔಷಧಿಗಳಿಂದ ಚಿರಪರಿಚಿತವಾಗಿರುವ ನಂಜನಗೂಡಿನಲ್ಲಿರುವ ವಿವಿ ಪಂಡಿತ್ ಫಾರ್ಮಸಿ.
ಮೈಸೂರಿನಲ್ಲಿರುವ ಎಸ್ಎನ್ ಪಂಡಿತ್ ಫಾರ್ಮಸಿ, ಕೊಟ್ಟಕಲ್ ಹಾಗೂ ನಂಜನಗೂಡಿನಲ್ಲಿರುವ ಆರ್ಯ ವೈದ್ಯಶಾಲಾ, ಕೇರಳದಲ್ಲಿರುವ ಅಂಬುಜಾ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಆಯುರ್ವೇದ ರಿಸರ್ಚ್ ಅಂಡ್ ಡೆವಲಪ್ಮೆಂಟ್, ತಕ್ಕಿಣಿ ಆಯುರ್ ಆಶ್ರಮ ಹಾಗೂ ಗೋಕರ್ಣದಲ್ಲಿರುವ ಸಸ್ಯ ಸಂಜೀವಿನಿ ಪಂಚಕರ್ಮ ಸೆಂಟರ್ಗೆ ಭೇಟಿ ನೀಡಿತು.
ಹೀಗೆ ಈ ಎಲ್ಲ ಜ್ಞಾನ, ಮಾರ್ಗದರ್ಶನ ಮತ್ತು ಅನುಭವದ ಫಲವಾಗಿ 10 ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ವಿಶಿಷ್ಟವಾದ ಕಾಸ್ಮೆಟಿಕ್ಸ್ ಪ್ರಾಡಕ್ಟ್ಗಳು ಹಾಗೂ 6 ಆಯುರ್ವೇದ ಔಷಧಗಳ ಜೊತೆ ನಿಮ್ಮ ಮುಂದೆ ಬರಲು ಸಾಧ್ಯವಾಯಿತು.
ವ್ಯಾಲ್ಯೂ ಅಡಿಷನ್ಸ್ ಟು ಎನ್ಹಾನ್ಸ್ ದ ಸ್ಕಿಲ್ಸ್ ಆಸ್ ಪ್ರಾಕ್ಟಿಷನರ್ಸ್. ಇದೆಲ್ಲದಕ್ಕೂ ಮಿಗಿಲಾಗಿ ನಾವು ಉತ್ತಮ ಜ್ಞಾನ ಹಾಗೂ ಕುಶಲತೆ ಹೊಂದಿರುವ ವೈದ್ಯರಾಗಬೇಕೆನ್ನುವುದು. ಈ ನಿಟ್ಟಿನಲ್ಲಿ ಕೈಗೊಂಡ ಯೋಜನೆಗಳ ಪಟ್ಟಿ ಹೀಗಿವೆ.
ಇಂಟರ್ನ್ಶಿಪ್ ಪ್ರಾರಂಭದಿಂದಲೂ ನಾವು 10 ಜನರು ವಾರಕ್ಕೊಮ್ಮೆ ಕ್ಲಿನಿಕಲ್ ಕೇಸ್ ಡಿಸ್ಕಷನ್, ಶೇರಿಂಗ್ ಕ್ಲಿನಿಕಲ್ ಕೇಸ್ ಎಕ್ಸ್ಪೀರಿಯನ್ಸ್ ಹೀಗೆ ಹಲವು ಚಟುವಟಿಕೆಗಳನ್ನ ರೂಪಿಸುತ್ತಾ ಬಂದೆವು.
ಇಂಟರ್ನ್ಶಿಪ್ ಮುಗಿದ ನಂತರ ಇದನ್ನು ಮತ್ತಷ್ಟು ವಿಸ್ತರಿಸಿಕೊಳ್ಳುವ ಹುಡುಕಾಟದಲ್ಲಿ ರೂಪುಗೊಂಡಿರುವ ಕಾರ್ಯಕ್ರಮವೇ ಪ್ರಾಗಲ್ಭ್ಯಂ, ದ ಕ್ಲಿನಿಕಲ್ ಮಾಸ್ಟರಿ ಸೀರೀಸ್. ಇದನ್ನು ನಮಗೂ ಹಾಗೂ ನಮ್ಮಂತಹ ಇತರ ವೈದ್ಯರಿಗೂ ತಲುಪಲು ಡಾಕ್ಟರ್ ಪ್ರಶಾಂತ್ ಸರ್ ಹಾಗೂ ಡಾಕ್ಟರ್ ಅನಿಲ್ ದೀಕ್ಷಿತ್ ಸರ್ ಅವರ ಸಹಯೋಗ ಮತ್ತು ಮಾರ್ಗದರ್ಶನದೊಂದಿಗೆ ಇಲ್ಲಿಯವರೆಗೂ 6 ಸೆಮಿನಾರ್ ಪ್ರೋಗ್ರಾಂಗಳನ್ನು ಕಂಡಕ್ಟ್ ಮಾಡಲು ಸಾಧ್ಯವಾಯಿತು.
ಇಲ್ಲಿಯವರೆಗೆ the clinical onset, the journey towards giving up, dermatological insights from a clinician's perspective.
Effective communication skills in Ayurveda, Ayurveda approach to Ashmani, beauty cosmetics in Ayurveda. ಹೀಗೆ ಮೈಸೂರು ಮತ್ತು ಬೆಂಗಳೂರಿನಲ್ಲಿರುವ ಪ್ರಖ್ಯಾತ ವೈದ್ಯರುಗಳ ಕ್ಲಿನಿಕಲ್ ಇನ್ಸೈಟ್ಸ್ ಗಳನ್ನು ಪಡೆದುಕೊಳ್ಳಲು ಸಾಧ್ಯವಾಗಿದೆ. ಇದಲ್ಲದೆ ಆನ್ಲೈನ್ ಆಸ್ಟ್ರಾಲಜಿ ಅಂಡ್ ಯೋಗ ಕ್ಲಾಸ್ ತೆಗೆದುಕೊಳ್ಳುವ ಮೂಲಕ ಜ್ಯೋತಿಷ ಶಾಸ್ತ್ರ ಹಾಗೂ ಆಯುರ್ವೇದಕ್ಕೆ ಹೇಗೆ ಸಂಬಂಧಗೊಳಿಸಲು ಸಾಧ್ಯ ಎನ್ನುವುದನ್ನು ತಿಳಿದುಕೊಳ್ಳಲು ಪ್ರಯತ್ನಿಸಿದ್ದೆವು.
ಇದಷ್ಟು ನಮ್ಮ ಕ್ಲಿನಿಕಲ್ ಸ್ಕಿಲ್ಸ್ ಎನ್ಹಾನ್ಸ್ಮೆಂಟ್ ವಿಷಯಕ್ಕೆ ಸಂಬಂಧ. ಆದ್ರೆ ಇವೆಲ್ಲದರ ಜೊತೆಗೆ ನಾವು ಕೈಗೊಂಡ ಮತ್ತೊಂದು ಅರ್ಥಪೂರ್ಣವಾದ ಯೋಜನೆ, ಅದುವೇ ದಕ್ಷ ವೈದ್ಯರ ಜೊತೆ ಯುವ ವೈದ್ಯ ಸಂವಾದ. ಈ ವಿಶೇಷ ಸಂದರ್ಶನದ ಮೂಲಕ ನಾವು ಸಂಭವಿಸಲು ಬರೋಬ್ಬರಿ 11 ಮಾಹಿತಿಗಳನ್ನು ಅದರ ಪಟ್ಟಿ ನೋಡ್ತಾ ಹೋಗೋದಾದ್ರೆ, ಆಯುರ್ವೇದ ಕ್ಷೇತ್ರದ ಭೀಷ್ಮ ಡಾಕ್ಟರ್ CS ಸುಮೇಧಿ ಸರ್, ಶ್ರೀ ರಕ್ಷಾ ಆಯುರ್ವೇದದ ಡಾಕ್ಟರ್ ನಾಗೇಶ್ ಪಾಟೀಲ್ ಸರ್, ಖ್ಯಾತ ಆಯುರ್ವೇದ, ಯೋಗ, ನ್ಯಾಚುರೋಪತಿ ವೈದ್ಯ ಡಾಕ್ಟರ್ AS ಚಂದ್ರಶೇಖರ್ ಸರ್,
ಶ್ರೀರಂಗ ಆಯುರ್ವೇದ ಮಂದಿರದ ಡಾಕ್ಟರ್ ಪ್ರಸನ್ನ ವೆಂಕಟೇಶ್, ಆಯುರ್ವೇದ ಕ್ಯಾನ್ಸರ್ ತಜ್ಞರಾದ ಡಾಕ್ಟರ್ ದಯಾನಂದ್ ಹಾಗೂ ಆಯುರ್ವೇದ ಖ್ಯಾತ ಸಾಹಿತಿಯಾದ ಡಾಕ್ಟರ್ TR ದತ್ತಾತ್ರಿ,
ಮೈಸೂರಿನ ಪ್ರಸಿದ್ಧ ಆಸ್ಪತ್ರೆ ದೀಕ್ಷಿತ ಆರೋಗ್ಯ ಧಾಮದ ಡಾಕ್ಟರ್ ಅನಿಲ್ ಕುಮಾರ್ ದೀಕ್ಷಿತ್ ಮತ್ತು ಪ್ರಸಿದ್ಧ ವೈದ್ಯ ಹಾಗೂ ಗುಣಶಾಸ್ತ್ರಜ್ಞ ಡಾಕ್ಟರ್ ವಿ ರಾಜೇಂದ್ರ ಮತ್ತು ನಿವೃತ್ತ ಪ್ರಾಂಶುಪಾಲರು, ಬರಹಗಾರರು, ಅಂಕಣಕಾರರಾದ ಡಾಕ್ಟರ್ ಸತ್ಯನಾರಾಯಣ ಭಟ್,
ಖ್ಯಾತ ಔಷಧಿ ತಯಾರಿಕಾ ಸಂಸ್ಥೆಯಾದಂತಹ ಎಸ್ಎನ್ ಪಂಡಿತ್ ಪ್ರೈವೇಟ್ ಲಿಮಿಟೆಡ್ ಡಾಕ್ಟರ್ ಕಾರ್ತಿಕ್ ಪಂಡಿತ್, ಏಷ್ಯಾಸ್ ಫಾಸ್ಟೆಸ್ಟ್ ಗ್ರೋಯಿಂಗ್ ಕಂಪನಿಯಾದಂತಹ ಅಕ್ಟಿಮೇಟ್ ಸಂಸ್ಥೆಯ ಡಾಕ್ಟರ್ ಋಷಿಕೇಶ್ ನಾಮ್ಲೆ ಹಾಗೂ ಖ್ಯಾತ ಆಯುರ್ವೇದ ತಜ್ಞರು ದೂರದರ್ಶಿಯಾದಂತಹ ಡಾಕ್ಟರ್ ದಿಲೀಪ್ ಕುಮಾರ್ ಕೀರ್ತಿ. ಹೀಗೆ ಇಂತಹ ಹಲವಾರು ಮಹಾನ್ ಚೇತನಗಳೊಂದಿಗೆ ಸಂದರ್ಶನ ನಡೆಸುವ ಹಾಗೂ ಅವರ ಅಷ್ಟೂ ವರ್ಷದ ಅನುಭವಗಳನ್ನು ತಿಳಿದುಕೊಳ್ಳುವ ಅವಕಾಶ ದೊರೆತಿದ್ದು ನಮ್ಮೆಲ್ಲರ ಭಾಗ್ಯವೇ ಸರಿ.
ಹೀಗೆ ಇದೆಲ್ಲದರ ಜೊತೆಗೆ ಶ್ವಾಸತಂತ್ರ, ಆರೋಗ್ಯದ ವಿವಿಧ ಮಾರ್ಗದರ್ಶನ. ಈ ಸಂಚಿಕೆಯ ಮೂಲಕ ಆರೋಗ್ಯಕ್ಕೆ ಪೂರಕವಾಗಿರುವಂತಹ ಆಹಾರ, ಶಿಕ್ಷಣ, ಕೃಷಿ, ಹಲವಾರು ಕ್ಷೇತ್ರಗಳ ಸಾಧಕರೊಂದಿಗೆ ಭೇಟಿ. ಉದಾಹರಣೆಗೆ
ಸಾವಯವ ಕೃಷಿಯಲ್ಲಿ ಸಾಧನೆ ನೀಡಿರುವ ಬೇಸಿನಿ ನ್ಯಾಚುರಲ್ ಸಂಸ್ಥಾಪಕರಾದ ನವೀನ್ ಕುಮಾರ್ ಅವರು, ಸುಸ್ಥಿರ ಅರಣ್ಯ ಕೃಷಿಯ ಅಧಿಕಾರರಾದ ಶಿವಮೊಗ್ಗದ ಮಂಜುನಾಥ್ ಭಟ್ಟರು, ಹೀಗೆ ಹಲವು ಕ್ಷೇತ್ರದ ಪರಿಣಿತರೊಂದಿಗೆ ಸಂವಹನ ನಡೆಸಿ ಅವರಿಂದ ನಮ್ಮ ಸಂಘಕ್ಕೆ ಹಲವಾರು ಆಯಾಮಗಳಲ್ಲಿ ಮಾರ್ಗದರ್ಶನ ಪಡೆದುಕೊಂಡರು.
ಇನ್ನು ಆಯುರ್ವೇದ ಔಷಧಿ ಸಸ್ಯಗಳ ಕೃಷಿ ಹಾಗೂ ಸಂರಕ್ಷಣೆಗೆ ಸಂಬಂಧಪಟ್ಟಂತೆ ಕರ್ನಾಟಕ ರಾಜ್ಯ ಔಷಧಿ ಸಸ್ಯಗಳ ಪ್ರಾಧಿಕಾರದ ಡಾಕ್ಟರ್ ಪ್ರಭು ಸರ್ ಅವರಿಂದ ಹಾಗೂ KR ಪೇಟೆಯಲ್ಲಿ ಔಷಧಿ ಸಸ್ಯಗಳ ಬೆಳೆಗಾರರಾದ ಸಂಜಯ್ ಕುಮಾರ್ ಅವರಿಂದ,
ಅದಲ್ಲದೆ ಕಾರ್ಕಳದಲ್ಲಿ ಕೃಷಿ ಮಾಡುತ್ತಿರುವ ನಮ್ಮ ಗುರುಗಳಾದ ಡಾಕ್ಟರ್ ಸತ್ಯನಾರಾಯಣ ಭಟ್ ಅವರಿಂದ ಸುಸ್ಥಿರವಾಗಿ ಹಾಗೂ ಆರ್ಥಿಕವಾಗಿ ಲಾಭವಾಗುವಂತಹ ಸಸ್ಯಗಳ ಬೆಳವಣಿಗೆಯ ಬಗ್ಗೆ ಮಾಹಿತಿ ಪಡೆದುಕೊಂಡೆವು.
ಇಂದು ನಾವು ಔಷಧಿ ಸಸ್ಯಗಳನ್ನು ತಯಾರಿಸಲು ಪ್ರೊಕ್ಯೂರ್ ಮಾಡಲು ಬೆಂಗಳೂರಿನ ಅಮೃತ್ ಕೇಸರಿಯ ಡಿಪೋವಾದ ಚಿರಂತನ್ ಅವರು ನಮಗೆ ಹಲವು ಹಂತಗಳಲ್ಲಿ ಮಾರ್ಗದರ್ಶನ ಮಾಡಿದ್ದಾರೆ. ಪಬ್ಲಿಕ್ ಔಟ್ರೀಚಿಂಗ್ ಪ್ರೋಗ್ರಾಂಗೆ ಸಂಬಂಧಪಟ್ಟಂತೆ BSS ಅವರು ಆಯೋಜಿಸಿದಂತಹ ಆಯುರ್ವೇದ ಆರೋಗ್ಯ ರಕ್ಷಾ ಕಾರ್ಯಕ್ರಮ ಹಾಗೂ ಆಯುರ್ವೇದ ಸಂಶೋಧನಾ ಸಂಸ್ಥೆಯು ಆಯೋಜಿಸಿದಂತಹ ಹಲವು ಶಿಬಿರಗಳು, ಹೀಗೆ ಹಲವಾರು ಶಿಬಿರಗಳಲ್ಲಿ ಪಾಲ್ಗೊಂಡು
ಹಾಗೆ ವಾಟ್ಸ್ಆಪ್ ಮೂಲಕವೂ ವಾರಕ್ಕೊಂದು ಆರೋಗ್ಯದ ಅರಿವು ಸಂಚಿಕೆ ಹಾಗೂ ಆಯುರ್ವೇದ ದಿನಚರಿಗಳ ಉಪಯೋಗಗಳನ್ನು ತಿಳಿಸಿಕೊಡುವಂತಹ ದಿನಚರಿಯ ಡೈರಿ ಸೀರೀಸ್ ನಮ್ಮ ವೈದ್ಯಕೀಯ ಸೇವೆಯನ್ನ ಜನಸಾಮಾನ್ಯರಿಗೆ ತಲುಪಿಸುವಲ್ಲಿ ಸದಾ ನಿರತರಾಗಿದ್ದೇವೆ. ಇನ್ನು ಆಯುರ್ವೇದ ಕಮ್ಯುನಿಟಿ ಎಂಟ್ರಿಚಿಂಗ್ ಪ್ರೋಗ್ರಾಮ್ಸ್ ಗಳ ಬಗ್ಗೆ ಬಂದ್ರೆ ನಾವು ಕಲಿತದ್ದನ್ನು ಆಯುರ್ವೇದ ವಿದ್ಯಾರ್ಥಿಗಳು ಹಾಗೂ ಯುವ ವೈದ್ಯರುಗಳೊಂದಿಗೆ ಹಂಚಿಕೊಳ್ಳುವ ಧ್ಯೇಯದೊಂದಿಗೆ ಹಲವಾರು ಕಂಟೆಂಟ್ಗಳನ್ನು ರೂಪಿಸುತ್ತಾ ಬಂದವು. ಶುರು ಮಾಡಿದ್ದು ಕೇವಲ 2-3ರಿಂದ ಆದರೂ ಇವತ್ತಿಗೆ ಬರೋಬ್ಬರಿ 8 ವಿಶೇಷ ಕಂಟೆಂಟ್ಗಳು ನಮ್ಮ ಮುಂದಿದೆ. ಯೋಗ ವಿತರ್ಕ, ಪಿಜಿ ಸೀರೀಸ್, ಪತ್ರ ಸೀರೀಸ್, ವ್ಯಾಧಿ ವಿತರ್ಕ,
ಸಂಹಿತ ಸಾರ, ವೇದ ವಿನಿಶ್ಚಯ, ಎಜುಕೇಶನಲ್ ವಿಸಿಟ್ಸ್, ಎಂಟ್ರೆನ್ಸ್ ಮೋಡ್ ಪೋಸ್ಟ್ ಅಂಡ್ ಕ್ವಿಜ್, ಈ ಎಲ್ಲ ಎಜುಕೇಶನ್ಗಳ ಮೂಲಕ ನಮ್ಮ ನಾಲೆಜ್ ಅಂಡ್ ಟೆಕ್ನಿಕಲ್ ಸ್ಕಿಲ್ಸ್ ಗಳು ವಿಕಾಸಗೊಂಡಿವೆ.
ಹೀಗೆ ಪ್ರತಿ ಹೆಜ್ಜೆಯಲ್ಲಿ ಹಲವಾರು ಆಯಾಮಗಳಲ್ಲಿ ಒಂದಿಷ್ಟು ಕಾರ್ಯಕ್ರಮಗಳನ್ನು ಆಯೋಜಿಸುತ್ತಾ ಅದರಿಂದ ಕಲಿಯುತ್ತಾ ಬಂದಿದ್ದೇವೆ ಎಂಬುದೇ ನಮ್ಮೆಲ್ಲರ ಹೆಮ್ಮೆಯ ಸಂಗತಿ.
ಹೇಗೆ ಈ ಎಲ್ಲ ಚೊಚ್ಚಲ ಪುಟ್ಟ ಹೆಜ್ಜೆಗಳಲ್ಲಿ ನಮ್ಮ ಜೊತೆ ನಿಂತಿದ್ದೀರೋ ಅದೇ ರೀತಿ ಮುಂದಿನ ನಮ್ಮ ಎಲ್ಲ ಹೆಜ್ಜೆಗಳಲ್ಲೂ ನಿಮ್ಮ ಪ್ರೋತ್ಸಾಹ ಇರಲಿ ಅಂತ ಕೇಳ್ತಾ
ಈಗ ನೀವೇ ಹೇಳಿ, ವಸಂತ ವೈದ್ಯಾಸ್ ನಿಮ್ಮ ನಂಬಿಕೆಗೆ ಅರ್ಹರೇ?
Hello. Thank you for viewing our video presentations. We are thrilled to have been here, are sharing with you and look forward to your continued support. And stay tuned for more updates from Budding Ayurveda. With great pleasure, I now invite Dr. Pragalbhyam, a key member of Budding Ayurveda, to take a stage and share the inspiring story of Pragalbhyam journey so far.
नास्ति चक्षु समम तेजो नास्ति धान्य समम प्रियम नास्ति मेघ समम तोयम नास्ति च आत्म समम बलम. प्रागಲ್ಭ್ಯಂ ಕ್ಲಿನಿಕಲ್ ಮಾಸ್ಟರ್ ಸೀರೀಸ್. ಈ ಕಾರ್ಯಕ್ರಮದ ಮುಖ್ಯ ಉದ್ದೇಶವೇ ಒಬ್ಬ ಯುವ ವೈದ್ಯನ ಜ್ಞಾನವನ್ನು ಕೌಶಲ್ಯವಾಗಿ ಪರಿವರ್ತಿಸಿಕೊಳ್ಳಲು ಸಹಾಯ ಮಾಡುವುದು ಹಾಗೂ ಧೈರ್ಯದಿಂದ ಅಭ್ಯಾಸವನ್ನು ಶುರು ಮಾಡಲು ಬೇಕಿರುವ ಎಲ್ಲಾ ಅಸ್ತ್ರಗಳನ್ನು ಸಂಪಾದಿಸಿಕೊಳ್ಳುವ ದಾರಿಯನ್ನು ತೋರಿಸಿಕೊಡುವ ಉದ್ದೇಶವೇ ಈ ನಮ್ಮ ಪ್ರಾಗಲ್ಭ್ಯಂ ಕ್ಲಿನಿಕಲ್ ಮಾಸ್ಟರ್ ಸೀರೀಸ್ ನ ಮೂಲ ಉದ್ದೇಶ. ಇದರ ಭಾಗವಾಗಿ ಪ್ರತಿ ತಿಂಗಳಿಗೊಮ್ಮೆ ಈ ರೀತಿಯಾದ ಆಫ್ಲೈನ್ ಸೆಷನ್ ಗಳನ್ನು ಏರ್ಪಡಿಸುತ್ತಾ ಬಂದಿದ್ದೇವೆ. ಅದರ ಪಕ್ಷಿ ನೋಟ ನೋಡೋದಾದ್ರೆ, ಮೊದಲನೆಯದಾಗಿ ಕ್ಲಿನಿಕಲ್ ಅನ್ಸ್ಟ್ರಾಕ್ಟ್ ದ ಜರ್ನಿ ಟುವರ್ಡ್ಸ್ ಹೀಲಿಂಗ್ ಹಬ್ ಬೈ ಪ್ರಶಾಂತ್ ಗೋಖಲೆ ಸರ್ ಅಂಡ್ ಡಾಕ್ಟರ್ ಅನಿಲ್ ದೀಕ್ಷಿತ್ ಸರ್. ಎರಡನೆಯದು ಡರ್ಮಟೋಲಜಿಕಲ್ ಇನ್ಸೈಟ್ಸ್ ಇನ್ ಕ್ಲಿನಿಕಲ್ ಪರ್ಸ್ಪೆಕ್ಟಿವ್ ಬೈ ಡಾಕ್ಟರ್ ಸಂಜಯ್ ಕುಮಾರ್ ಸರ್. And third one, effective communication skills by Dr. Rajendra Prasad sir. And fourth one, Ayurveda approach to Ashmari by Dr. ಹೆಚ್ಚು ಯುಜಿಸ್, ಇಂಟರ್ನ್ಸ್, ಪಿಜಿಸ್ ಹಾಗೂ ಪ್ರಾಕ್ಟೀಷನರ್ಸ್ ಒಳಗೊಂಡು ಸಂಪೂರ್ಣ ಒಂದು ದಿನ ನಾವೆಲ್ಲರೂ ಜ್ಞಾನದ ಕಡಲಲ್ಲಿ ಮಿಂದು ಹೋಗುವ ದಿನ. ಹಾಗಾಗಿ ವಿದ್ಯಾರ್ಥಿಗಳು ಹಾಗೂ ನನ್ನ ತಂಡದವರು ಈ ಸುವರ್ಣ ಅವಕಾಶವನ್ನು ಬಳಸಿಕೊಂಡು ಆದಷ್ಟು ಜ್ಞಾನವನ್ನು ಸಂಪಾದಿಸಿಕೊಳ್ಳಿ ಎಂದು ಕೇಳಿಕೊಳ್ಳುತ್ತಾ, ಗುರುಗಳ ಜ್ಞಾನ ಅಗಾಧ, ಹಾಗೆಯೇ ಅವರ ಪ್ರಾಕ್ಟೀಸ್ ಶೈಲಿ ಕೂಡ ವಿಶೇಷ. ಹೃದಯ ಮನಸ್ಸಿನವರು ತಾಳ್ಮೆ ಉಳ್ಳವರು. ಯಾವುದೇ ಮುಚ್ಚು ಮರೆ ಇಲ್ಲದೆ ನಿಮ್ಮ ಪ್ರಶ್ನೆಗಳನ್ನು ಗುಪ್ತವಾಗಿ ಹಂಚಿಕೊಂಡು ಬಗೆಹರಿಸಿಕೊಳ್ಳಿ. ಈ ಉಪನ್ಯಾಸವನ್ನು ನಿಮ್ಮ ಒಳಗೊಳ್ಳುವಿಕೆಯಿಂದ ಸಮೃದ್ಧಿಗೊಳಿಸಿ ಎಂದು ವಿನಂತಿಸುತ್ತಾ ನನ್ನ ಪ್ರಾಸ್ತಾವಿಕ ನುಡಿಯನ್ನು ಮುಗಿಸುತ್ತಿದ್ದೇನೆ. ನಾಸ್ತಿ ವಿದ್ಯೆ ಸಮಂ ಬಂಧುರ್, ನಾಸ್ತಿ ವಿದ್ಯೆ ಸಮಂ ಸುಹೃತ್, ನಾಸ್ತಿ ವಿದ್ಯೆ ಸಮಂ ವಿತ್ತಂ, ನಾಸ್ತಿ ವಿದ್ಯೆ ಸಮಂ ಸುಖಂ. ಧನ್ಯವಾದಗಳು.
Thank you, Dr. Mallikarjun, for the wonderful introduction and for sharing the inspiring story of Pragalbhyam journey so far. Your words have set the tone for fantastic event. As we invoke the blessings of Almighty, let's also seek the guidance of Lord Dhanvantari, the patron deity of Ayurveda. I request our guest, Dr. Dileep Kumar sir and Dr. Anil Dikshit sir, and our Guru, Dr. Prashant sir, to do the deity work, graciously light the lamp and shower the flowers to Lord Dhanvantari. And also request everyone to stand at their places. Thank you, everyone. Anil Kumar Dikshit sir, a constant supporter of Ayurveda Vaidyas with us today. We are deeply grateful for your unwavering support and association with us. Your generosity in hosting our Pragalbhyam session at your esteemed venue and your warm hospitality, love, care have made us feel at home. And we are thankful for the comfort and convenience you have provided. Your passion for Ayurveda is truly inspiring, and your dedication to promoting its principles and practices is admirable. Despite your busy schedule, you have always taken time to listen our program outlines, offering valuable insights and guidance. Your patience and fatherly advice have been instrumental in shaping our Pragalbhyam journey. As a well-known practitioner in Mysore, your friendly relations have been invaluable to us. Your recommendations and invitations have helped us secure esteemed guests and speakers for our programs. We are grateful for your efforts in promoting our events. Your selfless support and encouragements have meant the world to us. We feel fortunate to have you as a huge part of Pragalbhyam, and we are honored to have the opportunity to learn from you. Your presence has been a blessing to our organization, and we look forward to your continued guidance and support. Now I request Dr. Anil Kumar sir to address the gathering and to share his valuable insights.
रागादिरोगान् सततानुशक्तान् अशेषकाय प्रसुतान् अशेषान् औत्सुक्यमोह अरतिदान् जघाना यो अपूर्ववैद्याय नमस्तस्मै. Namaste all of you. It's a very happy occasion. Dr. Pradeep has come from all the distance from Kerala. It's a very nice occasion to be with him, participate with you all. I'm really very happy. I feel always like one as young as you to join and be a part of the deliberations happening. I wish the function all the best. I'm always with you. Thank you very much for the opportunity.
Thank you so much, sir. Sir, it's a humble request to accept this small token of gratitude as a symbol of our appreciation for everything you have given for us. We are grateful for your association and look forward to many more opportunities to work together. Sorry for the delay.
Thank you once again, sir. We are forever grateful for your kindness and generosity. Now let's introduce our esteemed speaker, who has travelled all the way from Kerala to Mysore on our request. It's our honor and privilege to introduce our distinguished speaker, a renowned Ayurvedic expert and visionary, Dr. Dileep Kumar PP, Director and Proprietor of prestigious Ambuja Institute of Ayurvedic Research and Documentation, AIARD. His institution has been a beacon for excellence in preserving and promoting the authenticity of ancient Ayurveda. We at Vasanta Vaidyas had the privilege of experiencing the warmth and generosity of Dr. Dileep Kumar sir's hospitality firsthand. Our team had the opportunity to stay at his institution for a few days, and we were overwhelmed by the wealth and knowledge and the learning that we gained during our stay. We are forever grateful for that experience, sir. With a rich Ayurvedic heritage spanning 7 generations, sir's expertise is rooted in his extensive education and experience. He holds a BMS, MD and PhD in Dravya Guna with an impressive 16 years of teaching experience. His tenure as a professor and HOD at Department of Dravya Guna in Parasinakadavu Ayurvedic Medical College is a testament for his academic excellence. Dr. Dileep Kumar's mission is to revive the originality of ancient Ayurveda, revalidating classical pharmacopoeia for global health. Through his work at AIARD, he is tirelessly documenting medicinal plants, exploring uncharted Ayurvedic classics, and conducting research to ensure the efficacy and safety of Ayurvedic treatments. What's remarkable about Dr. Dileep Kumar sir's practice is that he uses 100% classical formulations dealt within Ayurvedic classics. With over 27 years of documenting the efficacy, safety, and usage of these formulations in modern health issues, he has successfully tapered or replaced the allopathic treatments in numerous cases. His expertise extends to critical emergency diseases like COPD, acute urticaria, skin conditions, and asthma. With an impressive total number of thyroid patients dealt so far, from 1999 to 2025 has reached up to 12,735 cases. And hypothyroidism cases is reached up to 7,216 and hypothyroidism at 884. Thyroiditis 1,011, multinodular goiter about 3,046. Recently, Dr. Dileep Kumar sir has been nominated as an honorary professor at Kerala University of Health Science, a testament to his academic excellence and contributions to the field of Ayurveda. But what equally fascinates about Dr. Dileep Kumar is his passion for music. He is a gifted singer who can mesmerize audience with his soulful voice. Interestingly, he finds music in voice of people around him, a unique perspective that reflects his creativity and compassionate nature. Now let's welcome Dr. and Professor Dileep Kumar PP to the stage and share his insights on thyroid disorders and Ayurvedic perspective.
Wonderful morning. Thank you, Dr. Chaya. ಎಲ್ರದ್ದು ತಿಂಡಿ ಆಯ್ತಲ್ಲ, ಒಳ್ಳೆ happily sitting. Today I have not come all the way Kerala is very near. My travel line is Middle India, North India, but it's a short distance from me, of course. Let me just start the session. Let me start this session with 2 words. As a responsible Ayurvedic doctors, can you do 2 things? Respect the Apurva Vaidya. Second, obey the principle of Bhaishajya Kalpana. Apurva Vaidya is you only. Asmat param purvo na bhavati. Asmat param purvo na bhavati. Iti apurva. Apurva doesn't mean rare. Apurva is not a special eminence. Before your birth, it is not there with you. The doctor, the best doctor in you, started to serve for you with your birth until the last breath. is referred as Apurva Vaidya. Jagadi Roga, if you see the Vispati, Nirukti and Arthapati, you will realize the hidden meaning of Apurva Vaidya as nature's power to restore happiness, health and longevity. That Apurva Vaidya, whenever you treat a patient, please respect it. If you do any attempt against it, it will be a homicidal attempt, or the person will be purchasing death. That's what is being done around us in the name of healthcare. That's why I told at first itself, respect Apurva Vaidya. For example, if you stop medication by completely curing a disease, that means you are respecting Apurva Vaidya. Please do not keep on medicating our innocent public like other medical systems. That should be the mission of our Bharatam, Bhavam Jagam Talam. The shelter for the entire global population. They will come to our nation for their life, I'm sure, if we are challenging. Second thing I told you, Bhaishajya Kalpana. Bhaisha, you know, yoga, people are scared. People are scared. Please don't again torture them by showing the printouts. Today we are going to say a printout called TFT, isn't it? And calcium, sugar, pressure, cholesterol. Please don't harass them again. Already they are scared. So Ayurveda again want not to scare the suffering people who are already being tortured from the society. Their mindset is really in trouble because they have already started getting a fear of death. That's why obey Bhaishajya Kalpana. These are the two messages I wanted to tell you. Today we are discussing thyroid in the morning session. Because thyroid, if I say in the public, what they think, thyroid is a disease. It is not a disease, no, it's a gland. It's an endocrine gland, butterfly shaped endocrine gland situated in the front of neck. Anteriorly, why I am telling this anatomy? Because when you palpate a patient sitting right to you, when they say pain and discomfort these areas, you will realize more. It could be a complication of a thyroid disease. So, sternocleidomastoid muscle anteriorly, sternocleidomastoid and sternothyroid muscle anteriorly, and cricoid cartilage and tracheal ring are covered by the gland. Cricoid cartilage and tracheal ring. Again, it is situated in the spine level of C5 to T1. Cervical spine 5th to thoracic or dorsal spine 1. Again, there is a laryngothyroid cartilage superiorly. So we get a laryngothyroid cartilage superiorly. So these are the places people exhibit different types of complications and discomforts when a patient is presenting complaints or thyroid diseases, especially thyroiditis. Again, let me just tell you what are the types of cases. Are you following English? Kannada alli helbeku anta unda? Illalla? English tondre illalla ellarigu? So, thyroid function problems we treat with the printouts. Though the patient is asymptomatic, we treat with printouts. I will tell you the problems if you treat unnecessarily to a person without the underlying cause. Just by seeing the printout, if you treat, what will happen? We will discuss today. It's very interesting. T3, T4, TSH are the three thyroid function tests, isn't it? Total T3, total T4. Free T3, free T4. Protein bound plus presenting hormone of trio, thyronine. Thyronine are T3, thyroxine is T4, and thyroid stimulating protein, which is a glycoprotein, a hormone from the anterior pituitary with a stimulus from hypothalamic thyrotropin releasing hormone. This all holds importance in day-to-day activities, including bathing. And what happened to these natural hormones if you keep a patient under synthetic levothyroxine? What is that tablet? I will tell you. And what will happen if you constantly give that tablet throughout years? What is supposed to occur? We will discuss today. And we have taught in our college Vedic wisdom. 4.5 years plus 1 year house surrency we have been taught Nidanam, Samprapti, Upadravam, Udarkam, isn't it? And Chikitsa Siddhantam, different types of Amam, and its application we have learned, they have been taught us, gurus have been taught us, and we have passed with the distinction first class, whatever maybe. After completing in the house surrency, we are totally going to a new thing. I mean, right or wrong? After 4.5 years of learning, we are completely changing the scenario of practice in the house surrency. Not at all related with the academy. Please try to understand what I said. It's a challenge. After the 1 year of house surgency, we are registering in a state medical council to become practitioners for treating the diseases what modernists claim as disease. Am I right? Yes. So what we have to do? We have not got any platform to apply our Vedic formulation for meeting modern diseases. For meeting the challenges in modern diseases, where only public come as patients. Am I right? Yes. Public come as patient. Public pictures as disease in totally different way than what we have been taught in the colleges. Am I right? Yes. And the Nidanam, which you have learned in the Ayurvedic classics, are not at all using for instructing the patient as Padhyam. Am I right? Prashoshtha Tirishta Kartamla Ramanadivitahi Bihi Kodravoddalega Chanes Taddukarata Videhi Retrabitam Dhuma Bukhada Resa Satheva Vyayam Rushani Revnasha etc. in Khasam. Sorry, that one Asya Sukham Sapna Sukham Tadhin Yamivoda Haru Varsam I am saying in Meham Virithaha Rachastasya Mandagni. So these all we have been taught, we have learned, but we are not telling the patient to avoid these when the patient is presenting a symptom death in our classes, because we have not been trained in that way. And we instruct the patient, only the local people say, especially the doctors and other traditional healers, folk healers, what they say. If I am a vegetarian, I say don't take vegetarian to the patient. Though patient is having wholesomeness or something, as having non-vegetarian daily. Please try to understand what I say. These are the facts I have but that is in my practical life of Ayurveda. And Panchakarma need to be used. Doshaha kadajit kupinte jita lankana badani jita samshodhane resham na jata purulbhavaha. So how to apply this aphorism of Vedic wisdom? We will discuss afternoon session. Okay. Fine. Now the bell is rung. I will come to that topic. Let me just tell you what I am doing in my clinic. People come with burnout. For example, hypothyroidism. They will be taking Thyronol, L-toxin, which is nothing but levothyroxine. Levothyroxine is a material in the synthetic that L-toxin, Euthyrox or Euthyrox, then Thyronol and L-toxin are the three common forms available in India, which is nothing but levothyroxine. And they give it for hypothyroidism, and methimazole, neomercazole, which is carbamazepine, in hyperthyroidism. And with or without thyrotoxicosis, people come with these medicines to our clinic. Rarely people come without medical also, fortunately, but that too not less than 2%. So 98% people come with thyroid therapy. Okay. Before that, when TSH increase, T3T4 decreases. It's inversely proportional to thyroid hormones. T3T4, okay, are the thyroid hormone. And one more thing I wish to remind you, we will discuss last, calcitonin. Please be careful. Calcitonin is also secreted by the cells of thyroid. And we will discuss it. There is some significance of telling about calcitonin. That is what is being collapsed in the scenario by giving Thyronol, etc. Okay, I will come back to the normal story. When TSH increases, T3T4 decreases. Then you call it as hypothyroidism. When TSH decreases, T3T4 increases, that is hyperthyroidism. So only when T3T4 decreases, you call it as hypothyroidism. Only when T3T4 increases, you call it as hyperthyroidism. Common sense. But sorry, there are many instances in the scenario where only TSH increases. T3T4 will be normal, and they call it as a subclinical euthyroidism, where clinical symptoms are not being manifested. This is a dangerous situation where you should not treat the patient. You please treat for the cause of elevated TSH. I will tell you. Interesting. So now, there are instances only T3T4 is increased. TSH is normal. Okay, and again, TSH is low, but T3T4 is normal, not high. These all conditions need to be treated differently, which is not mentioned in allopathy practice. So where they blindly give Thyronol or L-toxin or Euthyrox, making the scenario worsen, they make hypothyroidism, they make hyperthyroidism, and patients start to get manifesting all the clinical symptoms what the Harrison's book of medicines are advocating for is happening. So coming back, Ayurvedic medicines are majorly Prakriti Sthapana. Shariro, Manaso, Prakrito, Sthapeti iti Vedana Sthapana. So, I will tell you in this session of the seminar the relevance of Prakriti Sthapana and the relevance of Vedana Sthapana. So, when a patient is coming to my clinic in 100 mcg morning in empty stomach, okay, with or without symptoms, I taper every month 25 mcg each by adding Ayurvedics. First month 75, along with Ayurveda. Second month 50, third month 25, fourth month no Thyronol, only Ayurveda. Then stopping including Ayurvedic medicine. That is what is being done since 1999 till 2025. Nothing happened to anybody. Again, people, they come with Neomerxol, with Methimazole, with hyperthyroidism. I stopped within 8 to 10 months it will take because dangerous to stop. It's a radio isotope. It's not a safe drug. I will tell you what will happen if you take medicines in long run. Then coming back to another topic which I have not told you, only TSH increasing in many situations. Why only TSH is increasing? It is not because of thyroid. Thyroid is innocent in that scenario. So I am coming back again. Why only TSH is increased, which is a secretion from the glycoprotein from the anterior pituitary. Okay. So, Shariram Sarvada Sarvam Sarvadha Vedurashak. Ayurveda Sakastena Veda Loka Sukhapradam. We need to know about the Shariram. We need to know about the Deham and Kayam in detail. Then only will be safe to manage the problems of health problems of the public. Okay. So now I will tell you why only TSH is increasing. ENT infections, viral infections, dental infections, eye infections, ophthalmology infections, and due to humidity variations in Ritu Sandhi, especially happening more from Vasanta to Varsha. 15 days Ritu Sandhi. Next, altitude variation. A person residing in Karwar, he is in a coastal region. If we lift him in a helicopter to Ratnagiri Hills, his TSH naturally increases to 17 to 20. After 72 hours, getting acclimatized. From fourth day onwards, TSH will be in normal limit 3.2 point something. So altitude, humidity variation, again stress factors. If you are directly seeing one accident, a bus full of people, if they are directly seeing one traffic accident, a very bad accident, everybody TSH will be increased to 7, 8. And in pregnancy, from second to sixth month of pregnancy, including the development of heart developing stage and when placenta, pre-placental phase, TSH is already proved as a survey as elevated. Actually, it is not a disease. So unnecessarily gynecologists give Thyrox. Okay, we will talk about it again. And repeated abortion. They claim this because of elevated TSH. Sorry, no. Not because of that. Again, migraine headache. Another reason for increasing only TSH. When the cerebellar and vertebral arteries restrict flow up to 30% due to two factors called serotonin and histamines. Serotonin, what is serotonin? 5-hydroxyamine. Histamines are bioactive amines. So these two phytoconstituents, biochemical components, restrict blood flow up to 30% to the brain, causing a headache called migraine, derived from Greek word means pulsating pain. So that migraine headache is also contributing elevated TSH without fluctuation of T3-T4 values. Ignoring all these realities, why should we, as a responsible Ayurvedic doctors in India, why should we support this system? And also, we don't need to strenuously refer our book for resolving the problem, which is actually not doing for a meritorious mission. Okay, so the T4 is a critical and sensitive thyroxine convert to T4 when the peripheral cells are utilized for controlling many electrolytes and minerals, biochemical activities and heart muscle sustaining the bioavailability of protecting enzyme to heart like lactate dehydrogenase. There are many important biochemical functions for TSH and also many more hormones derived in the metabolism of T3. T3 is the circulating, the effector hormone of thyroid, which is made possible by T4 when it is releasing to the. So, in this scenario, firstly I do tapering. The dosage of thyronol, etc. Second, I taper slowly the metimazole, etc. in hyperthyroidism with or without thyrotoxicosis. And if they are very rarely they give steroids, deflazacort, methylprednisolone and all they give. That also first 2 months I may take to stop that. Firstly, we need to stop the steroid, then only we should catch hold of the supplements. Otherwise, it is not safe. You can ask me why it is safe. I am adding Ayurvedic medicines with a totally distinct concept as Dushi Visham. Garam, Kirtrimam Garesapnu Grede without Hridayi. Ashtanga Hridayam Uttarasthanam. Majority of the people coming now, since some decades in the independent India, especially after globalization in 2000, people are coming to every clinic because of toxicity. So I have already given a paper to circulate. You can take the printouts later, dear Dr. Pavan. Because that article is taken from, it's a compilation from the National Library of Health. We got it from the American Thyroid Association, ATA. So that article clearly say involvement of phytotoxins, cytotoxins, aflatoxins, many more, erythrocin C, nuts, okay, and fruit poisoning, organophosphorus poisoning, endless number of toxins people are happily, innocently consuming in the Vyavahara Lokam. So, almost all diseases around us is because of toxicity. Actually, nobody is diseased in a sense. All are healthy, but we purchase death because we are rich. Because we are rich. Yes. After 1 or 2 decades, we have only money. We'll have only money to eat. We won't have good food to eat. That's the scenario becoming worsening. So now going to the, I think you might have understood the general spectrum of understanding thyroid disease. Primary focus has been given to detoxify body. Detoxify the body. Thyroid supplements in modern medicine, from steroids in modern medicine. Third, safe food. For some food to take some time. For example, apple, carrot, lettuce, ginger. Apple, carrot, lettuce, ginger. All in equal. The juice, if you take daily after lunch for 21 days, it's already proven as apple, lettuce, ginger, and carrot. These 4 items, juice, don't swallow. Though you are thirsty, don't swallow, egg them. Little by little. You take 10 minutes, slowly you have to drink. When at noon, after lunch. Okay, and it should be minimum 8 hours with the bedtime. You should give the gap with the 8 hours with the bedtime. Please don't sleep at daytime after drinking this. Sorry. If you want to sleep, you sleep, then you take this. ಊಟ ಎಲ್ಲ ಮಾಡಿ ಹೊಟ್ಟೆ ತುಂಬಿ ಮಲಗಬೇಕು ಅಂತಂದ್ರೆ ಸ್ವಲ್ಪ ಮೊದಲೇ ಹೋಗಿ ಮಲ್ಕೊಳ್ಳಿ, ಅದಾದ್ಮೇಲೆ ಕುಡೀರಿ, ಗೊತ್ತಾಯ್ತಾ? ಸೊ ಹಾಗೇನಾದ್ರೂ ಮಧ್ಯಾಹ್ನ ನಿಮಗೆ ಮಲಗಬೇಕು ಅಂತಿದ್ರೆ, ಸೊ ಕಮಿಂಗ್ ಬ್ಯಾಕ್ ಟು this will rectify versatile correction of thyroid. It will normalize TSH. It will normalize T34. If it is hyper, it will be controlled. If it is hypo, it will elevate. It's versatile. And many symptoms like palpitation, exophthalmos in gradual, and I did not say the course, 6 months, 21 days is a course. And give 1 month gap. After 21 days, you give 30 days gap. 6 times you repeat this 21 days course. You understood? 21 days you repeat for 6 times. No, maybe more than 1 year. Okay, so 1 month gap you have to give with every 21 days of supplementation. Okay, only during lunch. I will tell you why. If you ask, I will tell you why only lunch. Why can't we take at night and morning? It's a problem. I will tell you. It will increase calcitonin. If you take morning and night, increase procalcitonin. To increase the serum procalcitonin will be increased and can lead to sepsis. Staphylococcus aureus, Pseudomonas aeruginosa, which are apparently found in the vegetables. Pseudomonas aeruginosa, Citrobacter, Klebsiella, Staphylococcus aureus, all these culprits will play every games in the intestine. Will cause high levels of calcitonin. It will lead to calcium oozing from the bone to the blood. So we will be having poor bone density if you take morning and night same supplement I am telling you. Otherwise, it's a big miraculous supplement if you take it noon after lunch. I already answered it without your questioning. Because you may not ask, you may not remember all this at last. Okay, so first line. Prayoga Vijnanam, before food, after food, there is a concept. Okay, you jan ananna manna ado madhyante kapala ante grase sanam samudam this is aushadam. Everything I agree with you. But how and when? When you are trying to meet the challenges in modern disease world, very difficult to obey based on Panchavayu and not practical. So, before food, generally I say it is organ concern or system concern. After food, it's specific. I'll make it very simple. For example, if a thyroid has got a thyromegaly, multinodular goiter, more than 3-4 nodules in thyroid from the medullary nodules, dangerous. Again, if the thyroid has inflammation, named thyroiditis, we need to consider a medicine to act to the organ as a whole. Then we have to give the medicine before food. So, if you expect any pharmacological action from an organ in total or a system in total, neuroendocrine system, endocrine system, okay, or thyroid system or thyroid gland as a whole, organ concerned, the medicine, if you want to get result, you have to give it before food. You have to give before food. It's clear. Example, heart. Cardiomyopathy. You have to give medicine before food. Coronary artery disease. You have to give after food. So I am coming to that point now. Even if the nodule is a solitary nodule, if there is a single lesion in the omohyoid muscle contributing a complicated lesion inside the medulla of the thyroid, you have to give medicine after food. So if you want to expect, if you expect pharmacological action from a target position in a organ, you have to give the medicine after food. Is that clear? Another example, Dileep thrombosis. We have to give before food because it has to act from the level of apparent reticular endothelial system, hematopoietic system, etc. It has to give before food. For X-ray incompetence in a varicose vein, to give after food because medicine need to act in the target. Very simple. And this is what I have been concluding in 2 decades of medical management using Ayurvedic herbal formulations. So I was in a challenge of utilizing Vedic formulations written in Sanskrit, in Samhitas and Grantha, for meeting the challenges of modern pathologies. I think this has to be there in every Ayurvedic college of India. Then only doctors can be updated for getting more public acceptance. I don't know what I say. Otherwise, many have been, you have learned lot of formations from the Samhitas. Are you using all in your practice? You have to refer the book. So what should be your motive to refer the book? The main concern here. So now we have no data on Ayurvedic perspective anywhere. We have only data on modern system of medicine. We have only data on modern system of medicine. That's why it's a right time to prove efficacy, safety of Ayurvedic medicines and disprove the prevalent modern system as they are not doing right. Thyroid is a very good example for that. Okay, so this slide, thyroid functions, enlargement, thyroiditis, goiter, endocrine distress, thyrotoxicosis, all these medicine which we are giving has to be before food. Next, after food, Chaturvithamam, Alinam, Achalam, Chalam, Alinam, Dina are the four types of Amita uses Pachate Anedi. Shuktam Amam by Chakramani, Charaga, Tikagar with the Deepika. So, the fermentation for radicals of amines can be interpreted as Amam. So, here, ultimately, protein make every scenario Western. Proteins are the main cause of diseases. So here, second is your asthma or blacks, kidney. After surgery to a cell carcinoma, after surgery to a breast, after surgery of after lobectomy, in a sarcoidosis or pulmonary, okay, there are more susceptibility to get a secondary to the thyroid as it's a defense. So if we can treat that, So that's called secondaries. Post surgical, because subtotal thyroidectomy. I have tried my level best. I have stopped taking. That's only 34 cases I have tried in 2001, 2003. I completely stopped accepting people after subtotal thyroidectomy because there is no use of giving any Ayurvedic medicine for correcting thyroid functions. It will never be corrected. So there is no way to save them after once surgery is done. It's called subtotal thyroidectomy. Next, post-surgical, next trauma to the spines, resulting paralysis of thyroid ligaments can also be treated with Ayurvedic medicines. Next, toxicity, which is abundantly found in India. Highest toxicity level is in Kerala. Second, Punjab. Third, Andhra Pradesh. Fourth, Gujarat. The lowest toxicity level in the human civilization is in Sikkim. They never use debedding agent, they never use fertilizer, they never use any synthetic material in the cooking of food. But Meghali is totally different. They are purely non-vegetarian, but they use all the nuisance for making food tasty and attractive. Food need to be fascinated, food need to be tasty, food need to be addicted. That's why Northeast people, we select them with the cheap salary, more productivity. Public will be crazy to have food. It's a custom started from Kerala. So now it is investing to the nearest state, Tamil Nadu, Karnataka also. So please be careful. Usually this kind of cook will make the scenario worsen. More found abundantly found in star hotels. So star hotels are more unsafe than a local hotel. And again, salt biscuits, 50-50, Muscat Chaska, Monaco, Kranja. Our favorite biscuits. Sorry, dangerous. We add cracker salt. In India, cheapest in the world. And vinegar, which is acetic acid. We use in tomato sauce, chili sauce, soya sauce. We add all pickles and mayonnaise. We add olive, synthetic oil along with acetic acid, which is nothing but vinegar. The usage of vinegar is the main culprit in almost all diseases related with the endocrine glands. That really leading to death in decades, maybe short decades. So please try to understand this. The final culprit in food is nothing but jaggery. Mandia. Manti is the source of sugar, you know. I'm proud to say that because I used to say I'm a Karnataka. Because I am made as a good man from Karnataka. I was in Karnataka 10 years. When I started getting some mental maturity, I started to live in Karnataka. So my cultural level of thoughts are like a Karnataka. I write Kannada, I read Kannada, I have written my exam notes in Kannada. First year Padartha Jnanam, I have written in Kannada. So, Sringeri is the mother temple of me. So that's why I'm telling this, because Karnataka people, when you say them that this food is not good, they will never sell it. I'm 100% sure. Because though public ask more, if you go to ತೀರ್ಥಹಳ್ಳಿ ಶಿವಮೊಗ್ಗ ತರೀಕೆರೆ ಇದು ಒಳಗೆ ಎಲ್ಲಾದ್ರೂ ಹೋಗಾದ್ರೆ ನೀವೊಂದು ಒಬ್ಬರು ಸ್ವಲ್ಪ ಮಣ್ಣ ಸೇರಿಸಿದ್ದಿರಲಿ ಒಂದು ಪಲ್ಯಕ್ಕೆ ಯಾರಾದ್ರೂ ಅಲ್ಲಿಗೆ ಅವ್ರದ್ರ ಹೋಗಿ ಇದು ಹಾಕೋದು ಸರಿಯಲ್ಲ, ನಮ್ಮ ಬದಲಾವಣೆ ಆಗುತ್ತೆ, ನಮಗೆ ತೊಂದರೆ ಬರುತ್ತೆ, ಹಾರ್ಟ್ ಕಿಡ್ನಿ ಎಲ್ಲ ಹೋಗ್ಬಿಡುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರೆ 100% ಖಂಡಿತವಾಗಿ ಅವ್ರಿಗೆ ಮತ್ತೆ ಸೇರಿಸೋದಿಲ್ಲ. ಅದು ನನಗೆ ಇಫ್ ದೇ ಫ್ರಮ್ ಕರ್ನಾಟಕ, ಕೇರಳ ಹಂಗೆ ಹಾಗೆ ಅಲ್ಲ ಅದೇ ಅದು ಹೌದು, ನಾನು ಇನ್ನು ಹಾಕೋದೇ ಇಲ್ಲ ಅಂತ ಹೇಳಿ ಹಾಕ್ತಾರೆ. ಸೊ ದಿಸ್ ಇಸ್ ಆಟಿಟ್ಯೂಡ್, that's when I remember about Karnataka culture. So this is there with the Madhya Pradesh, Bihar. They are not very literate, the literacy is not there, but they are good people. Odisha also, Odisha, we have farms. My Santosh is my right hand, roaming all over the country to find out farmers and procuring my raw materials. So I know the culture of Indian civilization, but very bad in the first 3 states. I already told you. So this all reflect in the toxicity. Doctors are rich in these states. Kerala doctors are rich, Punjab doctors are rich. So jaggery contains all kinds of toxicity, which is phytotoxins, and again milk. Karnataka best milk in India is Nandini milk in the analysis. But in Kerala also problems with the milk. So aflatoxin, and aflatoxin is the major toxicity agent that cause milk poisoning through renin and also polyesterase, and it deform the cholecalciferol. I will tell you later. Calcitrol, alpha calcidol, and cholecalciferol are the 3 real calcium of human beings, not the elemental calcium, my dear. Cholecalciferol is getting polluted and structurally changed by drinking polluted milk, which is synthetic milk made from the Andhra cream, from the terminal ileum through the lacteal loops from the dietary lipids. Let it be. So toxicity is not a single word, though I have added in the last portion. Please don't ignore it. Toxicity is the 90% of reasons. Only 10% only environmental and hereditary. Only the remaining 10% only environmental and hereditary. Next slide, please. Next slide. Controversial topics on thyroidology and endocrinology in clinical practice. Propaganda against thyroid gland. I have thyroid. Public say to you, what does it mean? He should have thyroid, na? So doctor also, don't worry. Doctor will never repair that impression. Doctor will never repair that impression because doctor is living with this. Yes, my dear. Public has to be tortured. So this propaganda we should change. Being honest, Ayurvedic doctors in India, by hearing thyroid, they should not get fear. Next, illogical interpretations of thyroid functions in obesity. I will tell you the culprits in thyroid supplements. Stress factors, skin disease, endocrine disorders, and impaired immunity. These all are words of business. See, business is a good word. Business is a good word. I am not against it, but it should be meritorious. Sukhartha sarvabhutanam mataha sarva pravartaya sukham na vina dharmat tasmat dharma paro bhavet bhaktya kalyana mittarana seveta itara duragaha. Am I right? ನಾವೆಲ್ಲ ಕಲಿತದಲ್ಲ BMS ಅಲ್ಲಿ ಯೂಸ್ ಮಾಡ್ಕೊಳ್ಬೇಕದು ಜೀವನದಲ್ಲಿ. ಓಕೆ, ಸೊ ಇದು obesity. When you become obese without the arrangement of T3 T4 only by seeing the TSH because of other factors, if you give Thyroxine or Euthyrox or L-Troxin etc., of course obesity will reduce. Do you know why? It contains two steroidal materials which is called L-thyrophenol. I will tell you that there are two steroidal. It work as a semi-steroidal medicine, will give you a sense of well-being. It will control the infection. It will reduce the tooth pain. It will reduce your obesity. It will regulate the system of water metabolism. But you will be dependent on it. So, the step what modern doctors adopt by misinterpreting all these abnormalities are actually illogical. I will explain it today. Are you understanding what I am saying? Yes. Next, real cause of hypofunctioning are misinterpreted. Real cause, already I told you, food, stress factors, sleep. I have not told you about sleep. One should sleep. Shodasangam Kashayam I am giving to people with a non-drug history of thyroid. Just by sleeping normally, his TSH become normal in 1 week. Can you imagine? So, sleep is very important thing. So like that, the real causes of hypothyroidism are actually masked. And we should tell it to the public. Okay. Next, no logic to explain in asymptomatic. People are asymptomatic. They come only with burnouts. How can you treat? Who is the yogi? Who look? A person with no symptoms, why should you treat? In cholesterol, apolipoproteins, LDH, sugar, thyroid. He, the person don't have any problem. Why should you treat them? We'll argue. We'll have a debate today. Welcome. Okay. Next, no rationality in converting hyper or hypo to hypo during long time. I will tell you, I have seen lots of patients for 7 to 7 years of continuous medication for hypothyroidism lead it to hyperthyroidism. Then they stop L-Troxin etc. and start neomercazole. Okay, after starting neomercazole, getting palpitation, exophthalmos, exertion dyspnea, and low energy, protein metabolism is very low, liver dysfunctions, steatosis, hepatitis, all the nuisance they are getting. But doctor again don't stop neomercazole. Meantime, 15-20 years of life, very poor bone density. I will tell you one more disaster. By taking these thyroid supplements a long time, it will disable the precursor of calcitonin, which is called already called procalcitonin. Then what is happening? Calcium, zinc, phosphorus, magnesium, 4 more micronutrients will be inhibited in its bioavailability from the dietary lipids from terminal ileum. It will inhibit absorption of four bone micronutrients. What are they? Calcium, zinc, phosphorus, and magnesium. Then what will happen? In long run, they will have bone density problems, weight bearing, joint pain, hip, same place where C5 to T1, contributing brachial neuralgia asymmetrically. Okay, this site is again CTS. It will, some people have carpal tunnel syndrome, which will lead to brachial palsy with the surgery. They say it's a simple surgery. This whole nuisance can happen in this school of patients. So, next slide. Symptoms rarely subside with Western thyroid therapy. Allopathy is not a modern medicine. Allopathy is a Western medicine. If you handle Ayurveda for meeting the challenges of modern diseases, I will call you are a modern practitioner. So here, but in public enforced to continue medication is another confusion. There is nothing in it. You don't get scared. That's why I told this slide now. Okay. Next, no rationality as lifetime medication for thyroid. What is this lifetime? See, 19 years to 50 years is the time of making money. Sorry. This is our target. 3,000 micrograms is the per day requirement of a human being of calcium. Taking elemental calcium 500 mg only with the 20 micrograms will be absorbed in the body. In the 20 micrograms out of 500 milligram of elemental calcium will become unabsorbed and will come to the secondary circulation when it filters through the glomerulus. It causes galactiasis, renal concretions, low GFR. There is a test called eGFR, filtration rate, and it increases all disasters related to the kidney disease called cystatin C. CYSTATIN, cystatin C bracket nephrosis. This is a forecasting test to know kidney disease in advance. So every person who is taking calcium supplements, elemental calcium supplements, will have kidney damage. If body do not absorb, if they are not required for. So, Ayurvedic perspectives, this also I will tell you, okay, application of classical Ayurveda in Western medicine is a holistic approach. So I will give you all the formulations today. Okay, Ayurveda consider a man as a whole, not only thyroid. When thyroid problem rectifies, all the other underlying problems also are getting rectified, including bone health, sleep, strength of heart muscles, basic metabolic rate, protein absorption, and also kidney health in terms of excretion. And I have seen it is acquiring good bladder tone also, thereby preventing prostate issues in elderly males. So, systemic approach as endocrine system. I already told you that systemic approach. So, endocrine system, neuroendocrine system, okay, calcium channel system, angiotensin inhibiting enzyme system. So, in phytochemical level, it's called pharmacodynamics and pharmacokinetics. There are two types of modern research in Ayurveda. Please try to understand this. There are two important part of modern research in Ayurveda. One is called pharmacodynamics, second is called pharmacokinetics. Third one is pharmacotherapeutics, of course. So pharmacokinetics are the study on medicines, how a medicine after introduction to the body getting kinetically motivated. For example, Nimbadi Kashayam, Hamsabhadyadi Kashayam. Namakarana itself is reflecting a lot of meaning. Because it's a Dravya Sutram, so it is a study on pharmacokinetics. How the Arambha Samarthyam. Now, Dravaguna part 1. You remember? Yes, Arambha Dravya, Arambha Samarthyam. Pharmacokinetically important. That is the complete learning of molecular biology, nanogenomics, biotechnology advancements, analyzing classical formulations. It has got an amazing scope in the modern world. They are actually panic. Sorry. So second thing is called the pharmacodynamics. Pharmacodynamics is the study as a response from the body. When you introduce Ayurvedic medicines to the body, when it administered and when it is entered inside the body, what are the changes occur in somatic level, cellular level, histology or tissue level, psychosomatic level, and also neuroendocrine level is already the protocol is established only since maximum 10 years. Understood? So these are the two main branch of modern authentication of classical formulations. Please remember this. So you have an ample scope of revalidating and documenting. And please do not adulterate medicines. Use genuine raw materials to make your medicaments. Try to avoid company medicines. You can use it as a side, but try to use, that's why I'm here. It's a destiny that I have got introduced with this young team of enthusiasts, Ayurveda Vaidya. I totally appreciate them. Okay, so systemic approach, because we provide genuine raw materials from the farmers to the doctor. So you have to grow. Okay, so next one is systemic approach. Next one, target-based application. For example, nodule. Ayurvedic medicines, how it acts with the nodule, especially dangerous, risky medullary nodule, Ayurveda work. But with no history of radiation, no history of chemo, no history of oral chemo, no history of surgery. Even biopsy is a contraindicated thing for introducing Ayurvedic medicines. Biopsy or FNAC, fine needle aspiration cytology, will reduce the intracapsular pressure so that our medicines that contain high amount of phytosterols will be arresting its action going inside the capsule with the low intracapsular pressure because of the FNAC. That is why people after FNAC, please do not make a trial. Again, if it is a benign, carcinoid, or neoplasm, or malignant, whatever may be, if it has got a tendency to spread after biopsy, after FNAC, definitely it will start getting complication in maximum 6 months. So unfortunately, if you happen to treat, you are an Ayurvedic doctor, if you happen to treat in the meantime, everybody will say that because of your medicine, it got worsened. And have you got it? From my experience, Abhyasa, Prapajya, Siddhi, Karpasya, Prakashana. From experience only, I have been denamed a lot in 90s. Then I completely stopped. I have no mercy. Even if it's my father, mother also, I won't accept them. Once after they do, they never done. I'm simply telling exaggeration. Okay, don't take the right same spirit. Okay, so after FNSC, please don't accept. Okay, because of this reason. And all the secondary lipodenopathy, everything will be worsened. The next one, conservative management purely on the basis of symptoms. Ahara, Nidra, Abramacharya, digestive system, drug allergies in Western medicine, Serratia peptidase. I will tell you some medicines leading to thyroid abnormalities. Serratia peptidase usually give you antiseptic medicament in a road traffic accident. You please wait. See, immediately after discharging from the hospital, the TSH will be elevated for some period. Don't give medicine. Okay, I already told you that 4 supplements after lunch. Just give it. Don't give any medicines. Don't tell to take thyroid meltox, etc. Wait for 3 months. Nothing will happen. It will come down. So, drug allergy. Sulfur drugs, sulfur methoxazole, and anti-diabetic drug called 5-glitazole, voglibos, empagliflozin giving in diabetes, serratia peptidase given for again, COX-2 inhibitors, prostaglandin inhibitors they give, and methylamic acid paracetamol combinations. Okay. Again, there are 11 drugs already enlisted as increasing TSH as a transient response. It is not a permanent damage. So please try to again sulfur drugs, sulfur methoxazole, sulfur and trimethoprene combination, Septan DS, etc. But earlier in 90s, late 90s, we were using crystalline penicillin, procaine penicillin. It was actually safe. Even ciprofloxacin, sparfloxacin, that erythromycin, okay, roxithromycin, azithromycin, these antibiotics are actually safe. But potassium clavulate along with the 625 augmented is not safe. On a patient with the thyroid therapy. So 1 PD, they give augmented 625. In case if they have a drug history in last 1 month, please tell them not to take any medicine. Wait karo. 90 days. It's my observation period. Nothing will happen. Okay, so try to understand. Next. See, if you want to do post-graduation or PhD levels, if you want to do any clinical trials, these are the contexts that we can correlate with Rejo Dushti, Unmadam, where Viritha. What is Unmadam? Viritha, Dushta, Asuji Pojanana, Prasasanam, Deva Guridjana, Unmada Hildo, Harsha Guru, Mano Apika, Pashamasa Jeta, Tai Rakpasatpasi, Mala, Pututa, Urbata, Profession. So, Pradam Satistai, Mano, Hani, Promo, Yasha, Narese Jeta, Unmada, Viritha. Again, what is that? Viritha, Daishan, Viritha, Tata, Chatu Production, isn't it? So, again, Viritha. Again, Viritha. Dushna Asuji Vidha Prabhu and Anna, which is that Amra. So, next one is Arshas. Arshas is a metabolic syndrome. It's a metabolic distress because of, because of Grahani. Annasya Bhakta, Pittam tu. Pachakabhyam Puredita, Dosha Thatu Mala Adina, Mushma, Yatra Shastram, Tadadhishanam, Annasa Grahana Grahani Mata, Sa Eva Thanandri Matekala, Pithathara, Paya, Hamira, Yuki Viru, Puta, Kadiputai, Sidaba, Pasha, Mata, Galevasa, wherever Yamila, Mama. So, this Arshas is again another culprit. So, treat for that. If they have internal Arshas, rectal Arshas, or Bhakya Arshas, to treat for that. Tandraka Sandibadu. ತ್ರಯೋದಶ ಎನ್ನುವಂಥ ತ್ರಯೋದಶ ಸನ್ನಿಪಾತ ತದ್ರಗ ಸನ್ನಿಪಾತ resembles more with the context of thyroiditis. Next, I will give you a list of different types of thyroiditis with Hurtul's thyroid. I will tell you. Okay. Pittaja Visarpam, Paitaja Visarpam, Vatika. See again that alpha calcidol. Alpha calcidol has a role to maintain the tone of skin with the help of vitamin D3. It's also another culprit on thyroid therapy, make skin dry. And they say dryness of skin is because of hypothyroidism. They give medicine. Dryness is not going. Okay, so next, Madhika Kasam, Chaitra Kasam, Pradhamaka Swasam. कृत शंख मूर्ध उदर पार्श्व शूली क्षामानक क्षेत्र बल सर्वज प्रसक्त वैकुष्ठ समीरणान भिन्न स्वरूप हास अधिशुष्कमेव वातिकासम. So वातिकासम, क्षतजकासम, प्रथमकासम. History of trauma, chest trauma, history of fall, hitting back or chest. See, you have to rule out. Next, Jadavatam. It's called senile complications. It's called amyloidosis. You may not get in the Google. This is the real culprit making age-related complications present in your blood in the form of proteins, bad proteins, making all the nuisance in old age after 60 according to Charaga, after 70 according to Susodan, Diyarasti Vagbada. Am I right? Are you sleeping? Okay. So, Jaravatam, amyloidosis, amyloids. Please, maybe after 1 or 2 decades, when allopathy start to give supplements and medicines, it will be boosted. Now, as an attempt, they have already told methionine, glutathione, already started. There is a blood test now called homocysteine. HOMOCYS, HOMOCYSTEIN, homocysteine is a precursor of amyloidosis. Now they don't talk about amyloidosis because they cannot sell it now. They can sell methionine, glutathione because one tablet costs nearly 70 rupees. Check the online. So now the thing is, this is the precursor of amyloids. Blood test now is homocysteine, making all the nuisance, including vascular changes and heart issues. So, Jaravatam, it is dealt by Charak Samhita. Jaravata, due to Gramyahara. Gramyahara is not the food of village. Deep meaning. It has got a deep meaning. Vyakaranam, Sanskritam. It is not Kannada or Malayalam. It is Sanskritam. It's a language of documentation, my dear. So, next one is Agadam. What is Agada? Nagadam, na? It will not have a Samprapti. So, this is not the disease that in our books. 90% of the cases who are coming to your clinic are Agada patients. It is not dealt in the book. It is not Gada. It is not having Nidana Samprapti. Yes, because of Visha. Kartrimam, Vishamhi Deham Samprapya, Prak Dushedi Shonidam. Kappa Pitta Anila Stadu Sahadosha Sahashaya. Kappa Pitta Anila Sahadosha Sahashaya. One by one. Finally, it will lead to Ojo Hrasam, purchasing death. Very happily. We call it as scientific death. That science is being taught from from the class 1. Okay, so that's what is health science is advocating for. Next slide, please. Common presentations of thyroid to conclude Ayurvedic prescriptions. Functional hypothyroidism and thyroid. Euthyroidism is actually a fabricated word. No medicine is not required. Euthyroid is a normal thyroid. Another thing is thyroid toxicosis. Okay, so next is structural. uninodular, multinodular, thyroiditis, CA thyroid, goiter, thyromegaly, dysplasia, a kind of precancerous stage. Next is secondary complications of CA, post-surgical status, comorbidities in neoplasm, impact of radiation. These old patients we are getting in our clinic. We have to manage them. Okay, sir? Categories of patients to fix protocol. This is we are coming to the practice. Drug with the controlled hypothyroidism is different. Drug with the controlled hypothyroidism. Drug with uncontrolled hypothyroidism. One altroxon TSH is 10. It refers normal. One drug, one therapy in allopathy, TSH is still high. Very funny story. I have seen people. So next, hypothyroidism without drug history. Hypothyroidism without drug. These are the different categories. I will tell you why I am telling this now. Hypothyroidism without drug history. Very easy to treat. 40 days. 40 days. Enough. Result will start to reflect from the day 4 after 72 hours. If you come with a TSH 10-15 with a low T3 T4, firstly to my clinic with a no medical history. I can challenge you with you. Report can be made normal in 4th day. But should have no drug history. So next one is total course. I give 40 days because we need to wait for one MC among females, one protein metabolic cycle in males. That's why 1 month is minimum required. First 5, last 5 days for preparing for preventing the recurrence. First 5 days preparing, last 5 days preventing the recurrence. So in the middle, 1 month is the correction of the cycle in males and females. That's how it will take 40 days actually, 5 days before, 5 days last. Okay, so uncontrolled hyperthyroidism drug, hyperthyroidism without drug history, post-surgical secondary complications of thyroid functions. This is very complicated. Very complicated. Post-surgical secondary complications of thyroid, please don't accept. I never accept. Okay, I will refer them to homeopathy. Homeopathy, they do good. These post-surgical secondary complications of thyroid functions. Ayurvedic medicines usually do not work in my experience. Next one, thyroid function abnormalities due to toxic food. Gobi manchuri, corns, chili gobi, chili chicken. Okay, and very aromatic food. This all I already told you now from the hotel food, especially hotel food. And again, high levels of erythrocin C, equally responsible for diabetes and thyroid problems in tarboos, watermelon. Watermelon poisoning, deep green watermelon and orange are the two first class intoxicating fruit contributing diabetes and thyroid because of erythrocin C. It is using for preserving and also will repel flies when you open outside. No flies will come and it will become more reddish, sweet also. So versatile chemical, they abundantly use in tarboos or watermelon and also in orange. When the season of the orange will get rotten quickly. That's why they use apple also has got a lot of impurities. These are the main two culprits, watermelon and orange. So here, toxic food, you ask the patient what food you took last 15 days. They will tell everything with happily they will tell you. So you happily hear it and write down in your case it happily. And make him unhappy, make her unhappy, saying that don't take again. Understood? So this is thyroid. Beautiful without drug, just keep quiet. Same supplement, fourth thing already told now, give 21 days, that's enough. That will happen. Next, comorbidities in real factors of thyroid abnormalities, seasonal panic psychosis, etc. Panic psychosis, Christian females, financial debts, males. In India, other than Meghalaya, every state, males are responsible to make money, right? If I am not wrong, forgive me. Except other than Meghalaya, all states, my wife is here, I don't know whether she is hearing or not. Okay, other than Meghalaya, every state in India, males are responsible for making money. Let them celebrate, no problem. It's a good thing. But they are the people who get maximum stress. Understood? So it's also leading to money matters from top to bottom everywhere. Okay, so next slide. Standard protocol, Samana Chikitsa, conservative management. This is the, see, Samana Chikitsa we take to 68 days and 4 months. Usually with the 4 months it's over, because if the person is taking 150 mcg, 25 mcg taking every month means it will take long time na. First month 125, there is no 150 mcg, 125 is available. So they take 100 plus 25 extra. So we will tap up to 125 first month, second month 100, third month 75, fourth month 50, fifth month 25, sixth month only without run-out. That's months. So people more than a decade of drug consumption for hypothyroidism, we need minimum 6 months, 150 mcg. That's why another thing, the recent intake of Tylenol in 1 month, or understood, 20 days cycle we can give. If it is, especially if it is asymptomatic. I already told you, people not registering, just matter of 40 days. Already told you. Next slide. Kalpana, Kashayam, Vata, Sratam, Fandam, Panchavidha Kashaya Kalpana we have learned. But how many of Ayurvedic doctors in India are using the Kashayas dealt in the Samskrita Grantham? The Kashayam is not because of the Kashaya rasa dominance. Kasha Himsaya. Lankana Pachana is nothing. Something is Lankana Pachana. Lankanam is Samprapti Vikhatanam. Pachanam is the Vishesha Ama Pachanam. For example, if you use Ela Kanadi Destin Masam, if you diagnose a Vatika Swasam to a patient sitting right to you, if you select a Kanadi Kashayam, that medicine will do both. It will do Lankanam, it will do Pajanam. It will do Samprapti, it will do the Visheshama Pajanam. But what we have been taught in the AIRS, what is that? Panchakola from Mata. It's a uniform Amapajanam. It is not like that. Panchakola Fana cannot be considered as a versatile Amapajanam. It is an example for that. So every Samana Aushatham dealt in the Rogadhikaram, Roga Chikitsa Prakaranam of Samskrita Grantham in Ayurveda. All the former classifications are Samprapti Vikhatanam, which is Lankanam, it is Amapajanam. But what is the problem? Very hard to diagnose as per Ayurvedic norms. Am I right? Yes. The people who agreed it may be either final or half surgeons. Okay, so rarely phantom. The advantages of Kashaya are Kashahimsaya. It completely resolved the issue. Second, with no reoccurrence. Secure. Phantom we give, people are not intense need. We come in a time only for Samanya Chikitsa or Vyati Viparidam, not Hetu Viparidam. We can subside the symptoms. That we use Phanta. See, one pouch of 25 to 30 grams of coarse herbal powder. We are opening and pour 1 cup of boiling water, filtering by squeezing. Instant preparations called hot concoction in inferior language called English. Hot concoctions. That's what Western people say for Phanta. Decoctions for Kashayam. Let it be. Okay. So now rarely Phanta we use. Next, churna. How churna? Churna also can be taken as Phanta 5 to 6 grams. 1 teaspoon. Same method. But under only boiling water. You have to pour to boiling water. Swangashitam, when it becomes room temperature, filter it and take. That is one method of churna preparations. Minority of cases we directly mix and take in hot water. Only condition it has to be mixed with the boiling water, not hot water. For example, Tribhala, Vaishwanara Churnam, Shadharanam Churnam, Avibhata Churnam are the 4 common churna need to be added to boiling water. When you feel to take, all together you can drink. Intolerable. But regarding Punarvadi Churnam, Duritara Churnam, okay, and many more, all the, generally, all the churnas, Agrimukha Churnam, we can take it like a phantom, like hot concoctions, already I told you, but the only difference with the Phantakalpin 200 ml water, in Churna Kalpana we are taking 100 ml water. That's difference. Okay. So next, Resaushati Gudila, only I use. Hasuri, Mansi, Devi, you know this. So, Devi Chikitsa, Resaushata, 99% I use Kashta Aushadhis. Arogyavartini, Yakratari, Shodhani, Prabhagaravadi, and one more Brahadagradari. Yeah, these are the medicines I am using as herbal minerals. Okay, and Sudarshan tablet, so the Churnam, it's a good order. So, this was the Guligas, give me the number. मेरे को बहुत फर्क भी मिल रहा है. I am getting good result in patients, but without resources. Why we are focused on resources? Because we are not enough raw resources. That is why. Ayurvedic doctors are not getting good quality raw materials. That's the problem. Everywhere in India. In the name of Patala, they use Ayurveda in Tripura, Manipur, Sikkim, Arunachal, that entire belt. How can it be possible? Adulterating and substituting. Best percentage of generating in Indian market is in Bombay market, 31% only. Mind it. I will talk later if I am not. So next, Gugulu Guliga. Generally we are using thyroid disease. And there are some researches I can tell you what are the established phytoconstituents acting in thyroid disorders from classical formulation. What are the phytoconstituents in Kanjana Gugulu? Already ruled out. I can reveal today. It's a secret. And many more. Only this research started, documentation started only from 2016. Do you know another fun? I don't know. became outdated, proven as not authentic and immoral in January 2023. Do you know this, my dear? So they make concept of disease, they make concept of pharmacology. Okay, and we simply follow them for livelihood. So next, patent tablets. I will give you the list of patent tablets. Indian medicine is beautiful. I don't need any, because we all are living for fun. Fun is not mandatory for life. See, 80 kilometers bike, some of you may have it. And 120, 140 kilometers per hour, vehicles are moving. Good accidents, they say no surgery is required. Allopathy or modern medicine, we call, actually it's a Western medicine, beautiful, really good. But these are some examples for the nuisance. So next, Gandusha and Pathya are the last two contexts I wish to tell you. Asanchari Gandusha in Panchakarma, Pashat Karma. Another interesting I will tell you. People with thyroiditis, I tell two things. First thing, keep one mouth when you are bathing. Keep that anything you cannot see. Sorry. You have to keep it in the mouth. After doubling only you spit it out. You continue this practice in 60 to 70 days. TSH come down. Only in case of TSH elevated conditions, with or without any comorbidities. Okay. Second instruction. So, firstly, have a warm water bath below neck. Don't put your head first. You may be very stressful. Let it be. Okay. So, firstly, water with the warm water, then cold water bath. Okay. I have noticed that low calcium release from the intestines, mind it, just by doing this kind of bath. And hypothalamus stimulate for thyroid release hormone for making TSH efficient. Understood? Thereby getting the scenario established naturally. So hypothalamus is for temperature regulation integumentary system, right? Yes, temperature regulation master in the brain. So it has related with the metabolism, utilization of proteins, especially glycoprotein, nucleoprotein, and also maintaining the level of oxidation. It reduces oxidative stress, versatile. This bath, how it, that's why, what is that? Snanam, Deepanam, Ayushyam, Purusham, Urja, Balapradam. Simply understood. And do not do Vyayama. We will discuss. Vyayama is contraindicated. Vyayama never told in village area. I know you will Mama. I know that you will Mama. Jathavam, Karma Samardhyam, Deepa Agni Megastaya, Vibhakta Khanagatratam. What is the next word? Vyayamad, Panchami Ekavachanam, Upajayate. Why not ignoring that two words? If you have hrasam of Raghava, if you feel heaviness, Gurutva, Karmendriya hrasam, Deepta Agni, Malagini, okay, you do Vyayama. That too, Artha Shakti, the shape is the benefit. Even these two schools of people only indicated even with the half power. Are you understanding? So again, yoga. Yama Niyamasana, Maharam, Manaharam, Yaharam, Dharam, Samanti Ashtanga Yoga. After Yama Niyama, you have to practice Hatha Yoga, Pratipika, Dileep, Yogasana. Yogasana is not a exercise. It's a spiritually very elevated practice of life. Untold feel. Modern Indians are not eligible to do that. Our cultural civilization do not deserve to do Yogasana. Because we live only for money, my dear. We live only for monetary benefits. I will tell you, Yama means personal discipline. Niyama, social discipline. That's the Raja Yoga. We don't discipline. You go to the road, you can see that. So that's what I'm saying. From top to bottom, Kashmir to Kerala, Yogasana is not deserving. Sorry to tell this. Okay, but it's a great system of maintaining life for longevity and peace. Let it be. Chitta Vrta Nirodham, not at all possible. Not at all possible. Maybe possible in a temple if you are trying a lot. Maybe possible. Okay, let it. So, next slide. Patyam Pati Srotam Sahitam. Question session. Yeah. Pati Srotam Sahitam. We will discuss on Patya concept. Okay, please ask me about the Patya, etc. Common combinations Hamsapadhyadi, Vyakri Varunadi, Varunadi, Nimbadi, Guduchadi, Shodashangam, Vasha Guduchadi, Brahmachadi, Madhya Pushpadi, Daksha Samangadi. Please write these, we will discuss today in the interaction session. Next slide. Arjuna talk. Asanadi Ganam, Ankoladi, Purvisham, Dektagarasa, Upagulyadi. See, when go to my center for getting training, firstly I will teach to pronunciate it. Okay, then I will tell them to open their mouth. You want to say hello. Sorry. Tiktagarasa, Upagulyadi, Dashamolya Kadutraya, Pathana, Ushira, Adi, Ahatakam, the Shatavadi, Gopakanyadi, Rektabata Dilsa, Chandana Parpadagadi, in Bisapalilsa, Sahajivadi, Susurna, that is Petaga, Madhamaya Petaga, it's a Granthotam, Anbhutam, Navakarshikam, spelling like Navakarshikam. Okay, in Pushta. Next, Vadarata, it's actually indicated Navakarshikam. Commonly, I am giving Murthyasam in hypothyroidism. 99% of thyroiditis and hypothyroidism cases, I use Murthyasam as a common vehicle. Lakshmi Vilasarasam, Inguleshwarasam, Maran, Saptamrata Loham, Kanjanada Gugulu, Medhuvara Gugulu, Yogaraja Gugulu, Amla Vitanga, Shodhari, Prabhagarvadi, Agrivartini, Manasavtaradagam. Next. Chorna Tarvala Jornam, Gulucha the Jornam, Gulucha the Jornam is also using for muscle wasting, muscular dystrophy, muscular etc. Vaishwana Jornam, how with the Jornam? Pattern Gaitaran. Gaitaran has got some problem. Adi Aushadhi prepare Gaitaran. See, there is a phytochemistry. We will talk about it. Phytoconstituents. Okay, and yeah, TFN34 is a medicine good for hypothyroidism. Pattern medicine we are using to compensate the phytoconstituents of thyroid. So, along with Ayurvedic medicine, because Vedic medicines cannot supplement equal with modern thyroid. That's why we use patent tablets. Gaitaran already reported having little bit of iodine. So, all the other patent drugs are not having that, already unlaced. So, I have checked all the phytoconstituents in the marker level, NMC. Okay, that's called nuclear magnetic imaging. Making protein crystal. Next one, thyroflux. It's a medicine, a morning one in empty stomach, like thyroid. Thyroid wave is a very good medicine. Thyroid wave is very good medicine. Patent drug, stress comb for among dabber. Dabber का stress comb I'm using for stress relieving. Jessica for sleep, very famous. Night only give it. Alert Vasu. Vasu alert is also giving for people who are doing strenuous job. Stress and study is different. We will discuss it. Okay. But if stress and study, I will tell you. Stress means strain means morning till even if I continuous work, I can get strain. Stress means only 3 hours while I am working. I feel like 16 hours job. It is stress. Let it be. Next, Manomitram by AVN. Insulting is also good for inducing people with history of tranquilizers, sedatives. Vasospar, people with the Rosava status, you know, there's a liver, this one, Adipo or fat peroxidation can cause dyslipidemia among thyroid weights. It is being treated only with reduced statins by using Vasospar. Next one. Okay, classical reference. See, Galaganda Gandamala. Yeah, sorry. So I think I will tell you the phytoconstituents in Ayurvedic research. Okay, so we'll have a break. I know you are tired. I'm also tired. Thank you. Thank you. Is it there? Yeah. Very.
അല്ല സാർ ഇത് ഞാൻ നിങ്ങൾക്ക് ശേഷം പറയാമെന്ന് പറഞ്ഞു. ഇത് വേറൊരു സാറ് കഷായം കൊടുത്തിട്ടുണ്ടായിരുന്നു. പതിനഞ്ച് ദിവസം കഴിഞ്ഞിട്ട് ഇപ്പം ഇന്ന് വേദന ചെറിയ ചൂടോട് അരമണിക്കൂറിന് ശേഷം 1 ടീസ്പൂൺ
ಹೌದಾ ನಮಸ್ಕಾರ ಮೈಸೂರು ಕಾಲೇಜಾ ವಂಡರ್ಫುಲ್
ಏನು ಮಾಡಬೇಡ ತೊಗೊಂಬ ಅಷ್ಟೇ ಲಾಕ್ ಮಾಡಿ ಚಾರ್ಜ್ ಲಾಕ್ ಮಾಡಿ ಅಲ್ಲಿ ಇಲ್ಲ ಪ್ರಾಜೆಕ್ಟ್ರು ಆಫ್ ಮಾಡಿಸಿದ್ದಕ್ಕೆ ಹಂಗೆ ಚೂಪ್ ಸೈಡಿಂದ ಆಗುತ್ತಾ
bring. Thank you. I got it. Galaganda, Gandamala, Apache, Arbuda. Just only two things. Galaganda, Gandamala only told in the Hamsapadhyadi directly. Galaganda. See, in a goiter, single nodule, when it is over-functioning and produces more T4 associated with the low parathyroid hormone, getting low calcium. Okay, parathyroid dysfunction we say. That is a case of Galagandam, which is solitary nodule. Where this medicine is wonderfully working. Gandamala can be a colloid goiter. We give it before food. Please try to understand. Only Hamsapadhyadi Kashayam is the best in class medicine. If you use it before food, ideally in thyroiditis along with the Mrityunjaya Rasam, efficient in uninodular thyroid with the solitary nodule, if you give after food with the Kanjanara Gugulu. For a colloid goiter, you give along with the Meduhara Gugulu or Kanjanara Gugulu before food. So, before food medicines generally working as a membrane stimulant or biochemical transport facilitators. For example, it enables body to restore the effector system. Here we say target cells or precursors. This all function will be doing if we give before food. So, membrane stimulus, organ stimulus, system stimulus, transport of constituents by the body, including T and mRNAs. Everything is made possible if you give any herbal medicines before food. See, in the research of classical formulations, we have identified 5 constituents. Okay, 5 constituents are already ascribed as having pharmacological effect. It is more found with the maximum potency in kashayas. Okay, first one is phytosterol, PHY, phytosterol, which is acting like a steroid but it is not a synthetic steroid. So every herbal formulation contains phytosterols. Second, tannins. Third, camphorides, Kaemppherides, camphorides. Fourth, camphorides, I will tell spelling again, Kaemppherides, camphorides. Fourth, glucosides. 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 The fifth one is flavonoids. Flavonoids. FLAVOUNOIDES. So these five basic phytoconstituents are already enlisted as pharmacological correspondence that does the action. But may or may not be after 5 or 10 days again some more will be found out. Little bit. At present this is the scenario. So Hamsabhadyadi Kashayam contains maximum concentration of phytoconstituents than any other medications to treat thyroid dysfunctions. That's why we use Hamsabhadyadi Kashayam in all cases of thyroiditis and thyromegaly, like choroid goiter, multinodal goiter. It's a versatile. Again, very evidently using for thyroid toxicosis without drug history in allopathy. Mind it. Without drug history in allopathy. If you use along with metimazole or omeprazole, just carbamazepam, it will cause elevated LDH and low LVEF in the echo of heart. Ejection factor, that pumping of heart can be retarded in the ECG, in L2, depressed P wave and unequal distance of RR interval indicative of cardiomyopathy can be developed if you give Hamsabhadyadi alone with the neomorphazole. Okay, so these all are my empirical documentation. So that's what. Next, Vyakri Varnadi. I already told you, laryngothyroid cartilage. Laryngothyroid cartilage situated just superiorly to the isthmus of thyroid. We do ultrasound scan. There are many investigations related to isthmus, which is called as the mid part. Laryngothyroid ligament, cartilage can be inflamed. It can be thickened. It can have a pulling from the base of the vocal cord, may lead to slurred voice, dystonia of voice. Okay, and shout. When they shout, they will lose the sound. This kind of sounding abnormalities can be found when thyroiditis affect laryngothyroid cartilage. In that situation, we use Vyakri Varnadi Kashayam after food. Understood? So, see the Vyakri Varnadi. There are 3 types of Ayurvedic medicines in our Vedic wisdom. Idam agama siddhitvat pratyaksha bharadarshanaat mandarava samparayuktivam navivam. This is not a fun. I will tell you. There are 3 types of drug principles. There is a Siddhanta. Siddhanto nama parikshake bahuvitha parikshake udhi saatvetva sthapita nirnaya. So, there are 3 types of Ayurvedic formulations in general. First one, Arambha Samara. I am telling very easy. Yeah, coming to Namakarana Siddhantam. Namakarana Siddhantam. That's what. First one is Arambha Samarthyam. See, Hamsabhadyadi. What is that? One drug is named to the entire formula. Hamsabhadi. It's a Dileep Sutra. Hamsabhadi is nothing but Desmodium trifolium. Abundantly available. So, Hamsabhadi is the pharmacokinetically executing drug. Mind it. I already told you what is pharmacokinetic. So Hamsapadi is Harapa Samarthyam. Hamsapadi is pharmacokinetically executing the drug action. So there's a Namakaranam. Second, Vyakri Varunadi. Two names has been given. Vyakri Varuna. Understood? So Vyakri is Anubandhyam. Varuna is Anubandham. Don't say Apradhana Pradhana. It's a bad word. Please don't. First you must say Pradhana, second Apradhana. I said nahi bolna hai. Okay. So when two drugs are giving for a Namakaranam, first one is Anubandhyam, which is Pradhanam. Second is Anubandham. Okay, so here Vyakri is a medicine to facilitate neuroendocrine correction of sound box, laryngopharynx. Well evident. Varuna, Kapameda, Samaka, Grindhi, Chikilsa, it's a number one. As per Nasar, you know, as per Charaga, Krimi is not worm. You are saying Krimi as worm now. Krimi, if you see Vyutpatti, it is not worm. We'll discuss later. When people, albenazole, mebendazole, they say vermicide. Vedanta is not a vermicide. Vedanta is not a germ killer. Sorry. It's a flora correction. Krimi, I will tell you the Vyutpatti and the Vyukti. Arthapatti. As we don't know Sanskritam to explain Padam, Shaktam Padam, we don't understand what these slokas are actually mean. So Bhalasuti is very important, starting from the Namakaranam. See, Toyam Vidratha Andarasre, Andarvidriti. Okay, so Andarvidriti Asraye. Which vibhakti? Saptami. Which vajanam? Eko vajanamadi. Dekho. Solitary separating growth. Solitary separating growth to a kostanga, to a depending organ. Vyakri Varnadi is ideal. But Varna should be original. Kritiva, religiosa, Kritiva Narvela. Which part you will use? Look. Not the root. People use, in colleges they say root. In many places they, please don't use root. Root has no effect. Caparidol. So all the phytoconstituents are rich only in the bark. When it is invented, 3000 BC. Imagine it. See, that's what I'm saying. So, Vyakri Varuna, the Kari Shiguru Vishwa Pranavaha. So, this medicine should be original. Vishwa means Shundi. Shundi andre eno namma ginger organic agi bilisi lemon ಸೇರಿಸದೆ ಸಲ್ಫರೇಟ್ ಇಟ್ಟಿದೆ ಒರೆದು ಬಿಸಿಲಲ್ಲಿ ರೋಕ್ ಮೇಲೆ ಇಟ್ಟು ಒಣಗಿಸಬೇಕು. ಸಿಕ್ಕುತ್ತಾ ಇಲ್ವಾ? ಸಿಕ್ಕೋದಿಲ್ಲ. ಎಲ್ಲಿ ಸಿಗುತ್ತೆ? ಅದೇ ನಾವೇ ಮಾಡಬೇಕು. ಈ ಸಿಕ್ಕೋದೆಲ್ಲ ಅಡೊಂದಾಗಿ ಬೂಡಿಟ್ಟು ಇದೇ ಥರ ಅರಸಿನ ಟರ್ಮರಿಕ್. ಡೋಂಟ್ ಫಾರ್ ಫುಡ್ ಯು ಬಾಯ್ಲ್ ಆ್ಯಂಡ್ ಡ್ರೈ. For medicine, don't boil. Make it chips and dry directly for medicine. For food, you have to boil and dry. If you use boiled and dried turmeric as medicine, it is waste. Sorry. You may be liking it because very beautiful to see. You can shelf life more, of course, but zero effect as a medicine. So, this is how we have to firstly think about the Namakarana. First I told you, Pradhana, Arambha Samadhyam. Second thought, Anubandhyam, Anubandham. Third one is Prabhavajam. Indu Kandam is a name, Chandra Prabha. It is not named as the Chavana Prasham, Agastya Rasayanam, Naya Upayam, Navakarshikam already. Okay, so these are the medicine. Why it is named like that? Very interesting. I have already made some discussions with the Kaladi Sanskrit University with some scholars of grammar, Vyakarana and Vedanta. This is Vedanta. Any fiction or statements or practice based on a Veda, we call it as Vedanta. There is no Vedanta term anywhere. It is what you do out of this Vedic which is called Vedanta. So here, Tiktaka Rashtrabhulya, Tiktaka Kritam, Bhagulyada Kashayam, Arogi Raksha Kalpadharma preferred. It is very effective in infection related to thyroiditis. It is also called as lymphocytic goiter, lymphocytic thyroiditis, lymphocytic nodule. Tiktaka Rashtra Upagulyadi Kashayam. Lots of medicines. Trayandi contains Trayandi. What is Trayandi? Janshana Kurava, Himalayan drug. Trayamana, have you heard? Trayamana is Janshana Kurava. It is that is the genuine source of Trayandi. Trayandi is same synonym. Chamatkar Nikhandu. What is Nikhandu? It is not dictionary. Nitaram Khandede, Annatra Bhajyate, Aneni Nikhandu. I will take later. So, Nikhandus are written for fixing the identity and also for many other purposes. So, here, Trayandi, Trayamana, as we mentioned in Chamatkar Nikhandu, Ashtanga Nikhandu, South of the Nikhandu in first, then Madhabari Nikhandu, and also in Kayadeva Nikhandu. So, here coming back to Trayandi, this is a critical ingredient in this medicine. We use Brahmi as a substitute. Sorry, Brahmi cannot be a substitute for Trayandi. It's a Himalayan drug. Very difficult to get. We were struggling a lot to get this medicine. Now we are getting it. We are cultivating also in Himachal Pradesh. Okay, so next slide. Rashtrabhulya Kashayam, we are giving autoimmune thyroiditis. Autoimmune thyroiditis, asymptomatic autoimmune thyroiditis, we give it. Ushinadi, we give thyroiditis due to acidosis. Thyroiditis with the acidosis, okay, including hyperacidity, with the history of H2 blocker, omeprazole, lansoprazole, ranitidine, that one, many prazoles, when they are on, we give Ushiradi before food to equalize the pH to create a healthy flora in the stomach. Ushiradi we give before food and Hamsabhadadi we give after food. No, acidosis of the thyroiditis. Next step, that's a Samangati we give it for psychotic. This actually dealt in Udmada Chikitsa. Samanga is biophytum sensitive. Samanga Dracha is organically grown Dracha. Not from the Mysore market. Not from the Mysore market. So, organically grown dry grapes. Samanga is biophytum sensitive. It is not Manjishta. But Samanga said that Rubia cordifolia are not working in this context. Samanga is working, here it is substituting as, if you see the photo biophytum sensitive, can you search? Be a very important. See, I think you will know that Please see that. Now it's immediately take the mobile and see. Because it reduces sugar drastically. It reduces sugar drastically. In hyperglycemia, BIOPHY, it grows like a weed. BIOPHY, biophytum, sensitivum, SITIVUM, sensitivum. Okay. So I think you know that it's like a weed, everywhere it's growing. To plant after washing, just crush, boil in 1 cup water to 2 cup into 1 cup. Okay. ಕುದಿಸಿ 2 ಲೋಟ 1 ಲೋಟ ಹಾಕಿ ಸೋಸಿ ಅದು ಬೆಳಿಗ್ಗೆ ತಿಂಡಿ ಆದ್ಮೇಲೆ ತಗೊಳ್ಳೋದು. It is reduces sugar drastically. To be taken only at the morning. Biophytum sensitive. So here it is very good medicine in thyroid toxicosis, palpitation, exophthalmos, and stress, disturbed sleep, other mental aberrations, including paranoid psychosis. This medicine is well used in thyroid toxicosis. Asanadi we are using in dyslipidemia, especially LDL. You know the relation of hepatophosphorylated adipose dysfunction due to bile emulsification happening more on thyroid therapy in modern medicine, Western medicine. So then you can use Asanadiganam, same thing. Asanadiganam only if they have no drug history of statin. They should not have a drug history of statin. Even along with the statin, it causes fatty liver. Not safe to give along with the statin. It can cause fatty liver. See, 14 centimeters span can become above 17 in 1 month. Be careful. Next. But I have never reported any parenchymal changes, no steatosis, no dysfunction also. But size will could be because of peroxidation, lipid peroxidation. Okay, along with statins. Vashaguluchadi, like this. See, Vashaguluchadi we are giving low calcium in long time usage of thyroid supplements in Western medicine. Less than 8, 7.9, 8.2 low calcium milligram per deciliter. Okay, then Vashaguluchadi we give us phantom before food, Hamsabadhyadi after food in thyroiditis and nodules. So, Brahmendrakshadi we are using pyrexia associated with the thyroid nodule, frequent febrile pyrexia, fever, and hands are cold, body is hot, night time getting burning sensation, and the head is getting burning sensation, and of course local tenderness. Also, Brahmendrakshadi is using after food, then Hamsabadhyadi before food. So, next slide. It's a lot. I think Varanadi we are giving it colloid goiter. Colloid goiter. Before food we are giving. Thyromegaly. Varanadi very dangerous because it contains Bhallatakam. Purification of Bhallatakam is challenging. Ishtiga Churna Shodhana is not up to the mark. We have to properly purify, we have to dry it properly. Understood? So that's why Varnadi is otherwise super medicine for this one. Colloid goiter and thyromegaly to be given before food. And please don't give Varnadi on S2 blockage, proton inhibitors like omeprazole, lansoprazole, pantoprazole, and rabiprazole. Do not give when people take this, and also with the drug history also don't give because it can cause mucal scalds if you give it before food. And in case if you are necessary to give, you can give without S2 blockage as phantom after food. No problem. Okay, so it is evident that it reduces size of thyroid where there is no solution in allopathy. They go for surgery, excision, understood, and they lose their gland. Next one, Guluchadi already told you. The someone in URTI, upper respiratory tract infection associated with thyroiditis. You give after food Hamsapati is a common medicine. Hamsapati is a common kashayam. Next, Madhya Shanangam. They are giving the polyposis, nasal adenoids, nasal polyposis, and upper respiratory tract goes to viral comorbidity, goes to frequent attack of sneezing, nocturnal sneezing, or people on inhalers like fluticasone, budesonide, or inhalers, nasidone, octreotide, and when they use nasal spray, you can use Madhya. But what is the condition? Raw materials you should prepare. Whatever I say is really waste if you do not prepare. I am doing it, I am showing to these people since 24 years. Kashmir to Kerala doctors are seeing the power of Ayurveda and they start practicing. I help them. By giving that policy, I will tell you at least sort of business. This is a service. We'll tell at last. So you have a lot of provision to be an Indian doctor. The next is Mahadiktaram. It's a wonderful medicine. People with dyslipidemia and hypertension, with or without allopathic medicines for BP. AC inhibitors, Tagmesatan, Losartan, Olmesartan, okay, Perindopril, Cassidalbag, Sildenafil, hydrochlorothiazide, alpha blockers, all these so-called anti-hypertensive drugs, you can slowly taper. You can stop it in 5 to 6 months, along with the thyroid medication. If you use Mahadiktakam after food, see, 200 divided by 3 after food. That's the thing. See, 1 packet was herbal powder, boiled in 800 ml of water. This is a common scenario. 1 packet. If the minister, film star, magistrate, poor maybe, they have to do it. Otherwise, don't accept them. Let them go to allopathy. What's the problem? Understood? So, here, 1 packet in 800 ml water, boiled and reduced to 200 ml, make 3 equal parts. Morning 1/3, noon 1/3, afternoon, night 1/3 after food. Best versatile anti-hypertensive medicine. Pressure excited by the blood to the wall of heart is called blood pressure. It's a stupidity, I will tell you why. Are human bombs to blast? Since when man started to take allopathy medicines for BP? What is the mechanism? See, Mahadiktam is already reported to have re-establishment of vasomotor nervous system. Re-establishment of vasomotor nervous system executed by autonomic nervous system. Well evident. So this is versatile. It's a beta blocker and also it reduces adrenaline and it inhibits AC naturally for establishing permanent cure. Understood? So it gives normal elasticity to the tunica muscularis, which is the middle layer of the artery, making full body vasculature safe by maintaining so-called BP. Understood? This is a concept started from the Second World War among German soldiers. This story I will tell you later. Until then, nobody was taking medicine for BP. Let it be. Now, mortality rate increased because of BP after the invention of sphygmomanometer. Sorry. Sadavini Gopaganyadi Kashayam. Tetrabhuta Jinsa. Okay, so again, high BP cases with the constipation, we give Mahadeva 100 ml BD after food. I forgot to tell that. With the constipation, high BP people or allopathic medication in among thyroid patients, we give 100 ml BD after food, not 200 by 3. Clear? If a constipation is associated with कब्ज है तो LP जोड़ना है. Like 100 ml BD we are giving. Otherwise 200 by 3 well and good. Next one, Shadavari Gopakanya Chikitsa. Okay, so we are giving it in hyperthyroidism. Shadavari Gopakanya we are giving in hyperthyroidism. It regulates all the essential hormones and enzymes for restoring electrolytes and minerals in the blood, including vitamin D. We don't need to give weekly one source of vitamin D. Okay, but then Shatavari should be Shatavari, Gopakanya should be Gopakanya. What is Gopakanya? Sariva. Do you think we will get it? We will not get it. Hemodysmus indica, we will not get it. We may get Sarsaparla. Sarsaparla is not Sariva. ನೀವು ಗೊತ್ತಲ್ಲ ನೀವು ಉಪ್ಪಿನಕಾಯಿ ಮಾಡಲಿಕ್ಕೆ ಉಬ್ಳಿತಾರ ಗಿಡ ಅದಲ್ಲಲ್ಲ ನೋಡಿ ದಿಸ್ ಸಾರಿವೆ ಹೆಮಡಿಸಿಸ್ ಇಂಡಿಕಾ ವೆರಿ ಡಿಫಿಕಲ್ಟ್ ಬಿ ಪ್ರೊಕ್ಯೂರ್ಡ್ ಫ್ರಮ್ ಟ್ರೈಬಲ್ಸ್ ವೆರಿ ಡಿಫಿಕಲ್ಟ್ ಟು ಗೆಟ್ ಓಕೆ ಸೊ that's a problem. That's what I am saying to my dearest doctors whom I am considering as my own children. I am giving this raw materials to them. Understood? So this is just to equip them by giving weapons for fighting. Understood? So now Chandana Barpadagadi, Shadavari Gopakanya is a wonderful medicine, always giving before food for toxicosis and also hyperthyroidism. Not good in euthyroidism. Shadavari Gopakanya, if you give in euthyroid, subclinical euthyroidism, where TSH is 7-8, these are for normal. If you give Shadavari Gopakanya, these are for reduce. It will become a hypo. Like allopathy doctors are also doing. So be alert. Next, Navakarshikam. Navakarshikam, when skin lose the tone, dry skin, dry eczema, atopic dermatitis. Okay, like skin rashes, urticaria associated with the, we say it is Dhana Puttam Mamsa Asraya Dhana. When Vadarakta Agada manifest in Tvak, which is the Akhiroga Margam, which is Nadva Shakha, we give Navakarshikam Kashaya. Okay, so this is we are using in skin, this is associated with the thyroid issue. Next slide. Traditional formulation. Nimbadi, I have already given the ingredients to Dr. Pavel. Please share with all the people. You prepare it and see whether I am telling right or wrong. Okay, so Nimbadi again giving for thyroid carcinoma. Thyroid carcinoma, especially follicular cuboidal epithelium. I will tell you the. I told you one secret. I will reveal it today. I will tell you. See, from Nimbadi Yogam, we have started. Yes, I got it. It controls hepatic peroxidation. Nimbadi Kashayam controls hepatic peroxidation, so it will normalize the lipid, especially LDL, and epigallocatechin EPIGALLOCATECHIN. Epigallocatechin galeate is the active principle extracted from Nimbadi. Why I am telling this? Because see, we people take this kind of information from our Vedic wisdom and we give it to the multinational companies. They mimic it, make synthetic similar molecule in China and send back to our nation in one tablet 300 rupees. Because we are rich, we purchase it. And it will have side effects, not the real one also. So please do not reveal all this to company people. The innocent people, they do business in any way, but this is a disaster if you share all these informations. Okay, so next already phytosterols already group beta sitosterol is already found out. That's why this kind of documentation is already started now. I am only leading this kind of activities in Department of Biotechnology, inducing disease markers in albino rats. Inducing disease markers in albino rats in various universities of biotechnology. Okay, but they don't know why they do. Just give it to the data and keep it. Okay. Arjuna talk is very good for hypercholesteremia. Hypercholesteremia and this both are different contexts. When all the lipid profile are increased, we say this hypercholesteremia. Arjuna talk is good in hypercholesteremia associated with the thyroid dysfunction, especially if you give after food with honey, madhu yuktam. Ankoladi we give dietic poisoning. Because of poisoning, bad oils, 99% because of the refined oil lead to unsaturated cholesterol, increasing the risk of thyroid dysfunction, causing oxidative stress. Ankoladi is the best medicine which is a manuscript yoga. Next, Shodasangam. Shodasangam is giving for tranquilizing. People hyperthyroidism with disturbed sleep. Even sedations will not be working out. Salt fresh. Carbon, this one, Carpos, earlier type, alprazolam, this kind of medicines, carbon, these medicines are not working. That case, Shodasangam is working. We taper slowly and introduce it in 1 month. We can stop all the tranquilations and sedations in allopathy. So this is to be given before food, Hamsabhadyadi, after food. Next, Sarivadi Kashayam, we are giving multinodal goiter, which is functional. We also call it as, it contains cunic acid, myo-inositol, myo-inositol, and cunic acid is the secret of Sarivadi that reduces nodule size by necrotizing through a process called apoptosis. You know this. So we are reversing, bringing back the cancerous process. Wonderful medicine, but should not give it people with the history of biopsy or FNAC. Especially Sarivadi Kashayam, we are using also for PCOD, oophoritis, malignancy of ovary, cystic lesion of ovary, peritoneal, infravenous, para-aortic lymphadenopathy. Sarivadi is ideally used along with Anjanara Gugulu. So abdominal or peritoneal lymphadenopathy, Sarivadi Kashayam is well used. So it's basically a Pitaka chikitsa. Okay. Chronic cyst which is deforming the organ. Next, Madhuka Pushpadi Phandam we are giving to people with malignancy of thyroid associated with the tracheal pressure. No, it's a phantom actually. When trachea getting pressure, getting what sound we are getting, even this respiring, rarely esophagus get pressure, very rarely. That is what phantom we are giving night only after food. Along with the Hamsabadhyati and Nimbadi Kashayam. Nimbadi before food, Hamsabadhyati after food in malnutrition of thyroid, along with Mathagu Pushpati night after food. Next slide. Yes. So, there are tannins, gallic acid, and phytosterols, oleoresins. I forgot to tell you, oleoresins. Please do not discuss it to modern people. Oleoresins, okay, are also found as actively working in Vedic formulations in thyroid function abnormalities. Oleoresins. Sixth phytoconstituents. Okay, in specific to thyroid, oleoresins, which is a kind of flavonoids, but will have aromatic molecular oil. Okay, I think now we are coming to the end of session. Life is defined as the ability of blood to combine fat and water with the help of temperature. Panjigaranam. Death is defined as separation of fat and water when temperature is lost. Understood? Annasya pitta paktam, annasya pakta pittam thur, annasya pakta sarvesham paktana matugamata. Tanmudha stays up to the Chadagaha. So here, finally, please take care. Agni, Angati Vyapinodi, which is nothing but the life in you. Prana Apala Samam Pajam Yana Chadrutam, which is the life in you. Please don't ignore it. You are a doctor, be a responsible doctor, and these are the queries. What is the next slide? Before that. No, next, this one. You keep it. And why only Kashayam? Why no Alishta, Aswagata? Many of you may be thought. I have to ask me. I will tell you. Next, can we completely stop medication? These are the questions I got from when I am at the colleges, especially many institutes. I got this kind of questions. Want to explain public stress with allopathy doctors. Don't dename allopathy doctors. They are also living. They also should not dename us. So here there is no unethical competition. We all are working for a welfare. Yoga Kshemam. Okay. So no competition. And how we should convince the public without denaming the doctors. We will talk. Next, do we need to keep the patients under bhakti again? See, three things. Dry fish, vinegar, egg. Egg is not a food for human beings. Do you know that? Protein concentrate of an egg is equal to 1/8 of a copra poison, which is a heavily neurotoxic. Sorry. Dear egg lovers, please forgive me. There are two parts in egg. One is called nutritive part, the other one is called reactive part. Nutritive part contains nuclear proteins. That's what is being promoted by Egg Promotion Council for making business of algorithms and brain. Second part is called reactive portion, contains two parts. One is phospholipids, second homoalbumins. Phospholipids will cause all the nuisance if you have a viral fever. Virus will give wrong note to your DNA, will lead to malignancy if you are susceptible to get malignancy in your family, which is nothing but phospholipid. It will increase the phosphorylation, ADP to ATP, unwanted. Second, homoalbumin, heavy protein, high acidic pH 2 for pepsinogen release will disable all kashaya metabolism inside. So Ayurvedic medicine will become waste if you take egg along with Ayurvedic medicines. So egg, dry fish, because of heavy pollution in dry fish, that vinegar are the three main culprits should not be taken along with Ayurvedic medicines. So why no modern supplements? Also controversial. You may be seeing bloggers and YouTube supplementing, zinc, that one, this one, many things. Nah, omega 3. There are many fake, lot of false, not proper documented theories. We will discuss if we want. These thyroid issues leading to fat growth, never. At last, I will tell you, your body will never kill you. Will it? Sorry, will never. Okay, this 113 bodies inside this room, including me. This physical body is living for us. They are serving for your soul. Discriminate, your mind is a bigger culprit. Your mind will kill you. But your soul will never kill you. Mind is dangerous. So, control of yoga is required. Chitta-Vritta Nirodham, mind is a major culprit. And body, Atma, which is the soul, which is the real you, who is knowing the pain and happiness. Okay, so please mind it and let me conclude this session as time is really late. Okay, and seminars in Ayurveda never conclude as beneficial for the professionals. Am I right, my dear? Extremely sorry. I have attended lots of seminars across together investing. What's the benefit? How many of doctors are getting promoted in their livelihood? No, nobody. Understood? So we should change the scenario. Youngsters should be revolutionizing this unwanted culture. That's why. So our team is here to support you making distinct group in India for meeting the challenges. Okay. Ambuja Foundation is made by my patients at first in 2015. Its name was Karma Bodhaka Public Charitable Trust. It was the managing trustee. Now I become the complete full-time managing trustee, lifetime managing trustee, and full doctors are the trustees. So we do a lot of welfare programs for Ayurvedic doctors and farmers in India, from Kashmir to Kanyakumari. And we can just brief what will we do, and if time in your busy schedule, if you get time to see my YouTube channel, it is not from promoting viewers, sorry. It is just to give awareness to my dearest children named Ayurvedic doctors in India. So I'm just concluding the session for interaction next. Santoshji, I welcome Santosh to just brief what you are intending to do. Thank you so much. Jai Hind.
Actually, base protein we are going to get started of the Indian sentence that who probably is probably I will suggest formulation for the of specific condition for the so you know who 90% of the cases are other cases are individual and classical cases are ಪ್ರಭಾವ ಪ್ರಭಾವ ಸುಮಾರು ವಿಷಯಗಳು ಹಾಗೆ ಒಂದು ಎಕ್ಸ್ಟೆಂಡೆಡ್ ಸಪೋರ್ಟ್ ಅನ್ನೋದು ಎಲ್ಲ ಸಪೋರ್ಟ್ ಅವರ ಎಕ್ಸ್ಪೆಕ್ಟೇಷನ್ ಈಗ ಸಂತೋಷ
Thank you for the patient listening, and thank you, sir, for always sharing your wisdom to all the students and practitioners. Ambujam Foundation is intending to, with this seminar as well, intending to support all Ayurvedic practitioners who want to switch to classical practice. So this seminar is to help. That is the conclusion after the seminar is to help the professionals. So our team of Sir's junior doctors as well as myself, who is into cultivation of medicinal plants, we want to support you in all possible way to help establish a proper classical practice system. So our charitable mission is to conduct medical camps for providing medicines and periodical discussion on cases. So our team is always open. If you have any rare case, anything that you want to discuss, we get more inputs on how this can be resolved or what are the challenges. Sir and our team is always there. And also, so that there should be periodical discussion on cases as well, so that we are sharing information. We are not in isolation. As a group, we can always take this to a more, successful practice. And also we can do. Sir is always doing free awareness classes, so this is also open for online training. So if you want to form a subgroup in this whole practitioners and students who are here, you want to form a group, we can provide online trainings as well, so that you can get real-time help. And also for promotions, if your clinic needs support in any other thing, please don't hesitate, always contact us. Contact information is there. We will also provide you our phone numbers and thing. Also, the other point what our foundation is doing is entertaining farmer clusters, so that we are trying to engage as many organic farmers as possible to hold standing crops of medicinal plants which are required in practice. So young doctors going forward should not have the difficulties or we faced when we were meeting certain challenges. So our team is constantly trying to empower practitioners to use the best herbs available in the country. So we will, the Ambujam Foundation is going to support you in that sense, and also facilitate and upgrading your practice. Whatever form of practice you currently having, you want to upgrade to a classical system, we are ready to support you, and also provide medicines. Sir's promise here is that for 1 year, you want to really switch, for 1 year we will give you medicines also. Any classical formulation that Sir is using and you find it beneficial in your practice, Sir is ready to provide us. So finally, Sir has already made the profound statement that business is a service. So once you have a good service and you are going into the society and taking up challenging cases and curing people of diseases, then there's nothing like it. So thank you. Thank you so much.
ಪಾಸ್ ಮಾಡ್ತೀವಿ. ಯಾರಿಗೆ ಇಂಟ್ರೆಸ್ಟ್ ಇದೆ ಗ್ರೂಪ್ ಜಾಯ್ನ್ ಆಗೋಕ್ಕೆ ಅವರು ಬುಕ್ ನೇಮು ಮತ್ತು ಬೇರೆ ಕೇಳೋಕ್ಕೆ
ಈಗ ಸರ್ ಹೇಳಿದ್ದನ್ನು ಕನ್ಕ್ಲೂಡ್ ಮಾಡೋದಾದರೆ ಅಂಬುಜಾ ಫೌಂಡೇಶನ್ ಇಸ್ ರೆಡಿ ಟು ಅಂದರೆ ಪ್ರಮೋಟ್ ಅಂದರೆ ನಿಮಗೆ ಯಾವ ರೀತಿಯಾದ ಸಪೋರ್ಟ್, ಲೈಕ್ ನಿಮಗೆ ಕ್ರಿಟಿಕಲ್ ಕೇಸಸ್ನ ಹ್ಯಾಂಡಲ್ ಮಾಡೋದಕ್ಕೆ ಏನು ಸಪೋರ್ಟ್ ಬೇಕು, ಜೊತೆಗೆ ನಿಮ್ಮ ಕ್ಲಾಸಿಕಲ್ ಪ್ರಾಕ್ಟೀಸನ್ನೇ ಮಾಡೋದಾದರೆ ಅವ್ರ ಕಡೆಯಿಂದ ಏನೆಲ್ಲ ಸಪೋರ್ಟ್ ಬೇಕು ಆಸ್ ಅ ಪ್ರಮೋಷನ್ ಪಾರ್ಟ್ ಆಗಿರ್ಬೋದು, ಮೆಡಿಸಿನ್ಸ್ನು ಸಹ 1 ವರ್ಷಕ್ಕೆ ಆಗುವಷ್ಟು ಕ್ಲಾಸಿಕಲ್ ಮೆಡಿಸಿನ್ಸನ್ನು ಕೊಡ್ತಾರೆ ಅನ್ನೋಂಥ ಈ ಎಲ್ಲ ಎಕ್ಸ್ಟೆಂಡೆಡ್ ಸಪೋರ್ಟನ್ನು ನಾವೆಲ್ಲರೂ ಇಲ್ಲಿ ಸೇರಿರುವಂಥವ್ರು ಎಲ್ಲರೂ ಬಳಸ್ಕೊಳ್ಬೇಕು. ಐ ಥಿಂಕ್ ದಿಸ್ ಇಸ್ ಒನ್ ಆಫ್ ದ ಗ್ರೇಟೆಸ್ಟ್ ಆಪರ್ಚುನಿಟಿ ನಮ್ಗೆ ಸಿಕ್ಕಿದೆ ಸರ್ ಇಂದ. ಸೊ ಹಾಗಾಗಿ ಇಲ್ಲಿರುವಂಥ ಪ್ರತಿಯೊಬ್ಬರು ಯಾರು ಪ್ರಾಮಾಣಿಕವಾಗಿ ಕ್ಲಾಸಿಕಲ್ ಪ್ರಾಕ್ಟೀಸನ್ನು ಮಾಡಬೇಕು ಅಂತಿದ್ದೀವೋ, ಸೊ ಈ ಎಲ್ಲ ಅವಕಾಶಗಳನ್ನು ನಾವು ಬಳಸ್ಕೊಳ್ಳೋಣ ಅಂತ ಹೇಳ್ತಾ, ಹಾಗೆ ಯಾರು ಜೆನ್ಯೂನ್ ಆಗಿ ಇಷ್ಟು ಕಾಲ ಹೇಳಿದಂತಹ ಪಾಯಿಂಟ್ಸ್ ಸರ್ ಹೇಳಿದಂಥ ಎಕ್ಸ್ಟೆಂಡೆಡ್ ಸಪೋರ್ಟ್ಗೆ ನಿಮ್ಗೆ ಇಷ್ಟ ಇದೆಯೋ ಅವರು ಒಂದು ಸ್ಮಾಲ್ ನೋಟ್ಬುಕ್ ನಿಮ್ಮ ಬಳಿ ಬರುತ್ತೆ. ಈ ಸಪೋರ್ಟನ್ನು ಯಾರು ತಗೊಳ್ಬೇಕು ಅಂತಿದ್ದೀರೋ ಅವರು ನಿಮ್ಮ ನಂಬರ್, ನಿಮ್ಮ ನೇಮು, ನಿಮ್ಮ ಕಾಂಟ್ಯಾಕ್ಟ್ ನಂಬರ್, ನಿಮ್ಮ ಡೀಟೇಲ್ಸ್, ನಿಮ್ಮ ಇಮೇಲ್ ID ಇದನ್ನು ಬರೆದು ಪಾಸ್ ಮಾಡ್ಬೋದು. ಹಾಗೆ ಈಗ ನಾವು ಆ್ಯಕ್ಚುಲಿ 1 to 1:30